Non c'è nessuno.
Linda, dottoressa Montanari?
Sì, sono qua.
Ciao, sono Cocco, Nicola, c'è anche Roberto, non so se ci vedi, forse ci vedi se mi metto di qua.
Ti vedo di schiena, adesso di
Quello
fronte.
bello con i capelli lunghi.
Sì, aspetta, che provo a
Vicino c'è quello intelligente.
Non riesco a mettere in modo da vedere Ah, sì, eccoti.
No, scusa Linda, era solo per dirti che se te la senti, se stai bene,
Sì.
puoi farlo l'intervento, anche se hai da condividere una presentazione.
Sì, mi sono sentita con Giuseppina.
Perfetto.
Non posso resistere tipo 4 ore attaccata al video.
Buongiorno Linda.
Ciao Giuseppina.
How are you? Better?
I'm okay, better, but still, very dizzy because
Yeah.
I had this strange inflammation to the vestibule. So
Oh.
after COVID, second time.
Sorry for this.
And how was the dinner? Fantastic, no? Ciao Roberto.
Ciao. Looking at us will get better.
Yes.
Ok, Linda,
so
quindi
jealous.
più tardi ti facciamo intervenire, ok?
Va
Adesso...
bene. Hi Ab.
Ok. Ti stanno salutando tutti, però scusami, lo devo spegnere il...
Certo.
Ciao.
Okay. Good morning, Linda.
Hi.
Buongiorno.
Ciao. Yeah, I know.
We are in your country.
I know. I would have liked to be there.
You look like a...
Ça va, Linda?
Hola. Ah, Fadi, salut,
Si.
ça va?
Ça va et toi?
Un peu mieux, mais c'est encore un peu comme ça. Pas très équilibré.
Tu restes assise alors.
Oui, assise et... Bon, mais aujourd'hui, ça va un peu mieux. Ouais. Et toi, ça va?
C'est un voyage. C'est
un voyage. Bien le dîner?
Say a few words.
Hello.
Là. Chi è?
Filippa.
Ah, Filippa, hola.
Olá, Linda.
Come sta?
Tudo bem?
Com una pena de não estar aí.
Estava que íamos agora as duas juntas no avião de volta.
Esattamente, in Milano, in San Vittore, tenho pena mesmo. Foi bom o jantar?
Ótimo.
Ótimo.
Muito giro tudo. Muita
E
pena.
San Vittore também é giro, não é?
Sim, um espetáculo. Sim.
É. Na estrutura também é gira, não é?
E são todos muito simpáticos, tratam-nos muito bem. Não sei se estão a perceber alguma coisa do que eu estou a dizer, mas...
Sim. Ah, eles.
Vai, vou passar ao outro. Beijinhos, Linda.
Beijinhos.
The first one. Linda, you will be the first speaker this morning.
Yeah, with Josefina.
With Josephina, exactly.
Yeah.
Josephina is here.
I saw her.
Yeah, okay. And then Laura Baglietto. She's there. Okay. And then
Lara told me 15 minutes, more or less,
yeah,
between the two of us.
okay.
Well, maybe a bit more, but we'll try. You keep me the time. I know.
I will. Okay. But take your time. So we've got, I know Laura. Yeah. Take your time. And I think we're good in time today because there's one speaker missing.
Okay.
Yeah. We've got time, lots of time to discuss.
Okay.
And Philippa's also here. She presented her data collection yesterday. So we've something to build on. And we're already a little bit into the topic.
Good.
Yeah.
And pity that I missed I couldn't follow the workshop, but
Yeah. And you missed the dinner yesterday night.
And I missed the dinner.
There was
I know that I was there in San Vittore last year, so I would have liked to greet the women there, but
yeah. But we were not in San Vittore. We were in Bollate. That was
yesterday was Bollate.
And,
I've never been there.
There's a restaurant which has been noted in the Guide Michelin.
Really?
Yeah, it's an open restaurant for people from outside. Obviously, quite hip. And what was it called? It was called In Galera. So
in Galera. Yes.
And the concept was fine because people come from outside and go into prison, are losing their fear, and quite a good idea.
Nice. And you had some time to walk around yesterday?
Yes. Yeah.
But you know Milan already, yeah.
Not that much. I've been here only once. Saw the cathedral at that time, but not that much. No.
Yeah. It was a pity. But I know that it's difficult because very close to the prison there is the Last Supper, painting. I've never seen it.
Okay.
Yeah. Good.
Okay, Linda, I put the microphone aside just to say a few people, but come back to you and you will stay.
Yeah. I'm here.
Oh.
I see you.
Good morning, everybody. Welcome back after this long night. Just to ask that somebody maybe forgetted some mobile telephone. Can you check if you have your phone? Because there at the triage, they have found a telephone. Okay, just a question for people that are connected by Teams. You are beautiful, but we have to ask you to not use the camera during the meeting because the power is not really. So just the people that are representing can use the camera. Okay, thank you. Davide, you are also in presence, so you are everywhere. Okay. So, and just repeating that they have found a mobile phone at the triage where you left the luggage. Please check if someone has lost or forget it. And it's not a good brand, otherwise we will sell it. Another question, please, people that have to present this morning, if they want to share some slide, they can bring to me so I can charge on the laptop here. Thank you.
Do you prefer that I send to you and you share, or I share?
You can share directly. Thank you.
Okay.
Someone of you is still interested in the visit of Sant'Ambrogio Church, because the visit of group is too expensive, but we try to arrange some individual reservations. If someone of you is interested, give me your name. Esatto. Stagno.
Thank you so much.
We'll try to arrange the individual reservation. We'll try. I'm not so sure that we succeed in I hope. Anyone else?
Io ho lasciato la cartelletta,
Sì, a 5 minuti di pazienza. Io penso che
Everything okay? Shall we start?
Yes.
You both up from Torino.
In Italy, no.
In Switzerland, I'm German, but in Switzerland, you have to be here at 10 to 9. That's punctual. They're starting at 9. all your luggage is being stored away. So in Switzerland, so how sure it is when you were there 10 before?
My grandmother.
Yeah.
My grandmother. Railway station.
Yeah.
10 minutes. Absolutely.
Okay. Okay, can we start? So, good morning, everybody, and welcome back. So, on our tour from prison to prison. Working, okay. So, and thanks to Roberto and Lara for this unforgettable evening yesterday. So, it will have a particular place in our memory, I'm pretty sure. So, it was very nice evening, a little bit unforgettable. Please, Roberto.
Thank you. I know we this morning on the opening we have with us the regional superintendent of the penitentiary administration, Pietro Buffa. I'm particularly glad to introduce him because we have been collaborating strictly, particularly during the pandemic, during recent COVID pandemic, and on any other matters, issues, concerns of health of inmates. Is I feel I've always appreciated his understanding, his capability to jointly resolve the health problems of the inmates. And I am very glad to introduce him for a short speech. He prefers to speak in Italian, and Nicola will translate simultaneously. Thank you, Dr. Bucca.
Purtroppo tra i miei tanti difetti c'è anche quella di, nonostante che l'ho studiato per lunghi anni, di non essere in grado di fare un discorso in inglese che abbia, come dire, un senso comprensibile, ecco, diciamo. Allora, innanzitutto, buongiorno a tutti, benvenuti. Non so se...
Good morning, everybody. Welcome. Puoi fare frasi un po' più lunghe. You can make longer sentences.
Ok, va bene. Allora, buongiorno a tutti, benvenuti. Sono particolarmente contento che voi siete qua. Ieri volevo esserci, ma gli impegni non mi hanno impedito di esserci, ma ci tenevo. Perché mesi fa, quando Roberto Ranieri mi ha chiesto, mi ha notiziato di questo incontro e mi ha chiesto un piccolo saluto, un intervento, ben volentieri, per i motivi che poi vi dirò.
Okay, Dr. Buffa is very glad to be here and is apologizing not to be here yesterday and is going to explain why he is glad to be here for after being asked by Dr. Ranieri to participate. At the beginning he was apologizing because as many Italians, even after studying a lot of years English, we are not able to make speech very easily.
Sì, ha detto tutto, ho capito. Il motivo per cui mi piace essere qua è perché in questi anni di pandemia, tra le tante cose che abbiamo dovuto affrontare, abbiamo affrontato con una certa naturalezza e credo che sia come dire, essenziale per qualunque attività che veda come dire, insieme, diciamo, il penitenziario e la clinica.
Okay, it's very important for him to be here because in these 3 years of pandemic, one thing has been very relevant, both for the penitentiary part of prison life and for the health part.
Ed è una cosa che non si trova nei manuali e neanche dal droghiere, ed è un senso, uno spirito di collaborazione che è l'unico che ti consente di affrontare le questioni da più punti di vista senza intralciarsi, ma anzi aumentando la capacità di intervento.
And this is something that you cannot find in school books, you cannot buy in a shop, and is the ability to cooperate to reach a common target without fighting, but really creating a cooperation.
E credo che questo debba essere discusso, affrontato a latere di tutte le questioni cliniche, tecniche che insomma ci vedono protagonisti come professionisti.
He believes that this point of cooperation should be discussed besides and before everything, before facing all the challenges that people working in prison have to face every day.
Ed è per questo motivo che qualche settimana fa io, Roberto Ranieri e altri 2 colleghi che hanno vissuto in prima persona, in qualità di capi ufficio, la nostra attività di prevenzione e di intervento sul Covid, abbiamo pensato di cominciare a scrivere qualcosa.
For these reasons, some weeks ago, Dr. Buffa with Dr. Ranieri started also with other responsible to discuss how to write something considering the lesson learned from the COVID-19 pandemic.
E se dovessi dare un titolo a questo lavoro ancora in luce, è la normalità.
And if you would like to give a title to this report, to this work, should be normality.
Che spero che riusciremo a fare un lavoro pubblicabile e in modo da poterlo diffondere a tutti coloro i quali avranno la curiosità di leggerlo, perché è stato questo atteggiamento che ci ha consentito di lavorare non solo in questo istituto ma in tutti gli istituti della Lombardia, senza un approccio normale, senza un approccio collaborativo che si fondasse sulla reciproca fiducia, sulla reciproca comprensione, sulla reciproca disponibilità a fare le cose insieme, noi non saremmo riusciti ad affrontare il virus e i suoi effetti.
He really hopes that everybody will be able to read such a project, because without this approach that tend to be normal, without this ability to cooperate and to build a trustship between all the actors, probably activities during the pandemic in prison would have not been possible.
Di questo si parla troppo poco e questo è il motivo per cui abbiamo iniziato a ragionare nel senso che vi ho appena detto. Peraltro questo lo dico perché anche per quello che è il focus di questo incontro, cioè affrontare, prevenire attraverso le vaccinazioni altri tipi di virus, eccetera, anche questo non è apparentemente semplice, ma in realtà molto complesso.
This discussion about normality is quite neglected because, for example, for topics like vaccination, it tend to be given for obvious, but in reality, to act normally is quite complex.
Non è sufficiente mettere un foglio in bacheca offrendo ad una popolazione detenuta la possibilità di vaccinare. Ci vuole molta informazione, ci vuole molta comprensione, ci vuole conoscenza dell'ambito in cui si lavora e delle reciproche specificità, difficoltà, modi di vedere, responsabilità.
It is not just creating schedules and list of patients. Making projects on topics like vaccination involve also the ability to build trust with patients, to build comprehension and cooperation with the other actors, so it's the complexity.
E con queste poche parole che vi auguro veramente buon lavoro e vi ringrazio di essere venuti qua a lavorare con noi. Grazie.
Thank you, and we wish us the best working day for today. Thank you.
So, sorry. The first session in this morning is about assessing vaccine literacy and vaccination services in prison. So Erika Dufell is not here. Instead, Lara will assist and co-chair the session. Many thanks for that, Lara. And the first speaker is also a result of the pandemic. It's a Zoom link to Portugal, to Lisbon, with Linda Montanari from the European Monitoring Center for Drugs and Drug Addiction. And she's a specialist on prison health. Many thanks. Good morning, Linda, to Lisbon.
Good morning.
Fine. That works. And Josefina Mavrou from Cyprus, and they will both together present EMCDDA data collection for tools for prison settings. Many thanks. And I don't know, what's your agreement? Will Josefina start or Linda? Linda will start sharing these slides.
Yeah. Thanks, Anno. Can you hear? Yeah. I tried to share the slides. Can you see it?
Not yet.
Can you see?
Yeah, now it's working.
Okay. So first of all, good morning, everyone. And I'm really sorry I could not be there with all of you that I would have liked to stay with you these 2 days for this important conference, and especially in San Vittore, where I spent last year 2 weeks, thanks to the help also of Dr. Raniere and Dr. Giuliani. And I would have really liked to greet the women that I met there July last year. So we prepared with Josefina this presentation on the implementation of data collection tool of the European Monitoring Center for Drug and Drug Addiction, together with the project.
Linda, can you?
Yes?
Just excuse me for interruption. The presentation is not in full screen mode, so would you, can you?
It's not full because I put in full screen mode. Maybe I try again.
Yeah, thank you.
Is it now okay?
No, we don't. No, we don't see the screen anymore now. I mean, your screen.
I don't know if Josefina, do you prefer to? I try to close and open again.
Okay.
Sorry.
Oh, Linda, apri di nuovo la presentazione, scusami.
Com'è?
Apri la presentazione. Come
Sì,
prima.
l'ho aperta.
Ok, mettila in condivisione come prima.
Sì. Sì.
Un attimo che lo vediamo anche noi. O vedi, in alto a destra c'è il tasto della presentazione, dopo salva, sopra salva, sì. Più destra, più a destra, più a destra. In alto, più a destra.
Sì.
Da sopra.
No.
E sotto. Qua.
No, non quello, in alto.
Sopra.
C'è
Sopra
la vedi?
Sopra insert.
Sopra insert.
Sopra insert.
No,
Ok.
Quello, bravo.
Adesso? Funziona?
No, guarda, vai avanti così, però devi far scorrere le presentazioni, le
Ok.
diapositive, ok? Grazie.
Ok, mi dispiace. So as I say, we prepared this presentation on the data implementation of data collection tool in the MCDDA and with the PRS project that Josefina is coordinating. First of all, as you know, the EMCDDA is a decentralized agency of the European Commission, and we have the objective to provide factual, reliable, and comparable information on drug and drug addictions, which includes trends, situation, responses, best practice, and policies. So regarding the prison area that I'm coordinating at the center, we focus now on 3 objectives. So first, improve the evidence on the problems and the responses available for those with drug use problem in prison. And monitoring the situation, we work with 27 European member states, Norway, Turkey, and until 2020 UK. We would like to disseminate the evidence, so through information, training, and better respond to the needs of those that are living in prison and working in prison, in particular now focusing on prison professionals, but also, so the final aim is really to try to provide evidence for then decision maker to take the right decision in terms of health intervention, social interventions for those people. Here we put 3 examples of publications. The last one, the most recent, is an overview of the situation of prison and drugs in Europe that was published in June 2020. But they also put here a publication that we have done jointly with the CDC on prevention and transmission of blood-borne viruses in prison setting, coordinated by Lara, and also another publication on new psychoactive substances in prison. During the COVID, we published together with Roberto Ranieri and other Fadi and other professionals also in our, yes?
Sorry again to interrupt. You should click on the slide because we don't see them. I mean, we only see the first slide.
Ah.
No, noi non vediamo in modalità presentazione, quindi ogni volta che cambi slide devi schiacciare sopra la slide così noi la vediamo.
Ah, ok.
Penso che tu abbia il speaker mode nel tuo computer e quindi qui noi vediamo il secondo, come se vedessimo il secondo schermo qui. Capito?
O vuoi maybe Josefina would like to share? No.
No, ma lei secondo me ha la...
Ok, così.
Esatto. Sei capace di fare duplica schermo?
Non so.
Dipende.
Scusa. Open.
Ok, adesso la vediamo. Adesso vediamo la slide 3.
Ok, allora lascio così. Ok. So this is an example of the data that are provided in the inside. As you can see, this is on the left, a graph on lifetime prevalence of injecting drug use before and during imprisonment in 10 European member states. I won't enter into the detail of this data, but as you can see, there is injection both outside and inside. So it's an issue that is relevant, especially when we talk about infectious diseases. The second graph is the number of countries where a selected number of interventions are available, going from large availability, at least official availability of HIV, HBV, HCV testing in 29 out of 30 countries, up to only 3 countries reporting, for instance, needle and syringe program. This is just as an example. And what we try to do, so the main issue that we were confronted with is the fact that there is a lack of data, the lack of comparability. So we tried to establish a framework to develop monitoring drugs in prison in Europe. There was a document from the Council of the European Union that then we tried to implement. First of all, trying to make maximum use of existing data collection tools, so improve synergies with other international organizations, including WHO, UNODC, CDC, Council of Europe. We develop a questionnaire that is the focus of this presentation, the European questionnaire on drug use among people living in prison. We are finalizing a questionnaire on facilities to collect information on intervention, health and social intervention in prison setting. And also we receive from the 30 countries every year a report on drugs in prison, touching on different points from the situation to the available intervention and the new projects. I would like just briefly mention that we are currently carrying out some projects. One is the identification and description of models of care for the eliminations of hepatitis in prison, coordinated by Pisa University with the CDC, and the selection of one prison in one of each of the country mentioned in brackets, so San Vittorio prison, Montpellier, one prison in Austria, Berlin prison, and the prison in Madrid. The second activity is the prison and drug trainings. We have settled down most of the material and we are now looking for options for implementation of this material with WEFRAN, CIPOL, maybe talking about summer school. And we would like really to focus on the needs of our customer, particularly focusing on prison professionals and participating in international foreign projects, including PRS and RISE-Vac project. The QDP, the European questionnaire, as I say, the objective is to improve the comparability. It is a model questionnaire, not mandatory, that we offer to the country, we build to the group of experts for conducting prison drug survey or surveys that include also information on prison and drugs. Up to now, 11 countries have implemented either within their national or local survey on prison drugs, the QDP. Those are the abbreviation of the country, and through the project that Josefina will present also, 4 more countries have started to use the instruments. The questionnaire is not just a questionnaire, it is a package available in 6 languages, German, English, French, Croatian, Portuguese, and Slovenia. And it includes a short version, a long version of the questionnaire, and methodological guidelines. We have established a working group. We start to meet online, in fact, much before the pandemic because of the lack of resources. And we have established an agreement, which I think is quite an interesting way and approach to work. So we have a central case level data database that is available for everyone to use to try to improve and enhance the analysis on these data. The ongoing analysis as those mentioned here, so one methodological on the questionnaire, one on drug use prevalence, one on imprisonment and infectious disease risk, one on relation between drug use and recidivism, one on women pathway towards prison and incarceration, and one on opioid use and opioid agonist treatment coverage. The structure, the questionnaire is structured in 6 sections, so it's all available online, you can download. There is a general part, one section on substance use outside and inside prison, one on substance injecting and health risk behaviors, one on health status, including infectious diseases, of course, one of use of health and addiction services, and one on social reintegration. Another important part of this document are the methodological guidelines, where we define the principles. For instance, the idea that the aim of this survey is a public health scope, the ethical standard that should be included, some more methodological guidelines on recommended periodicity, sampling, individual rights, confidentiality, data collection method and management, methodological specification for each question, Then we try to give any definition for every drug-related intervention mentioned, and in annexes there are examples of informed consent to be used during the survey, the street names in different countries of substances used in prison, and the checklist with the most important steps to be followed. Just to mention briefly the new instrument that we are finalizing concerning focusing not on the population but on intervention inside prison, and is an adaptation of a facility survey for drug treatment services in the community, but adapted to prison, again including a package with short, long version, methodological guidelines, and definition of the different intervention, but where we try to look not only at the availability, but also at coverage, staff, service provision, and there is a section also on drug testing. Here, just shortly example of what we got from existing data. For instance, here is the number of drugs used in prison according to the data collected in those 7 countries, and you can see there is a huge variability that may depend on different factors. As you can see, may depend on the type of substances, but also methodological information and methodological differences on which we would like to work. And here, again, I don't enter into the detail, but as you can see, there are still, there is work towards harmonization, but there are still differences in the methods, and this should be considered when the results are interpreted. And I think these also pass to the point of implementation and difficulties in implementation and problems that we have to solve. So I think we have done quite some progress, but there is still work to be done. And with this, I give the floor now to Josefina to present how this instrument and the adaptation of this instrument has been implemented in the countries that are belonging to this European funded project PRS 20. Josefina?
Yes, thank you very much. If you can go changing the slides for me.
Yeah.
Thank you. So we are currently running the European project in Cyprus. We are coordinating the Cyprus National Addictions Authority. It started in January 2021. We are participating 5 countries: is Cyprus, Belgium, Greece, Lithuania, and Luxembourg. The aim of the Justice Project is to assess the needs of the inmates and the ex-inmates with a history of a drug use. So we are using the instrument of the CDDA we just saw that was presented from Linda. Next, please. So what I will present now, we don't have any data so far. We are doing the research. We are in the stage where we are implementing the instruments in the different countries. And as you will see now, we have some difficulties. So I will be presenting this stage of the project. In Cyprus, so far, we have a sample of 120 questionnaires so far from 2 different prisons, the Cyprus Prison Department and the Sovereign Base Areas Police. The data collection started in February this year, and we are planning to collect more data by the end of the summer, if possible by July. We want to reach a sample of 400 questionnaires. It's a bit difficult, but we will try. And we are also conducting interviews. We have conducted so far 3 interviews from ex-inmates and 2 interviews from the Sovereign Base Areas Police. So far, we haven't found any difficulties since we are collaborating with the Cyprus Prison Department. So our access to the prison is quite easy, and they are also helping with the research. Next, please. in Belgium. In Belgium, they are at a good stage so far. They have conducted 158 questionnaires and 27 interviews in one prison. They had some difficulties due to the overcrowding, the lack of resources, the increase of workload and the COVID situation. So they are trying now to get access to another prison department in order to have a bigger sample. The aim is 400 in each country. If we won't be able to reach it, we will try to have the biggest number possible in each country. They just informed us before I come here to Milano that one more local prison has given access to the researchers in order to conduct the survey. Next, please. In Luxembourg, we have a big of problem, let's say. They had a difficulty in the research, not due to the prison as such, but due to the ethical committee. They had to send a lot of, I'm going to speak in Spanish in a bit. I'm thinking in Spanish always. So they had to send a lot of times the questionnaire, the consent form to the ethical committee. So we had a big delay in Luxembourg. So they announced us lately, last week, that they are going to, they approved the instrument and they will start in the following weeks with the research. So they expect to collect the quantitative data in one weekend, and we planning to finish by the end of June, beginning of July. And the questionnaires will be distributed by the prison staff and nursing staff. Next, please. In Lithuania, they are very advanced. They have actually finished the survey. They started very early. It was easier for them to get access to the prison with the ethical committee. So they have collected 400 questionnaires so far, and in 5 different prisons. They have conducted 10 interviews with 10 inmates in the 5 different prisons and 8 interviews with ex-inmates. They had no major difficulties apart from the restriction measures in each prison for the COVID-19. The only thing they reported is that some of the prisoners returned the questionnaires, but they were not fully fully filled. And also they had some problems with the researchers that they were contracted outside the organization. So that was an issue that they had to do some special, let's say, contracts with the researchers. Next one, please. In Greece, we had the same issues as well due to the COVID-19 restrictions. The survey has not started yet. They had made some efforts the last month, so they are planning to start between June and July 2022. They will get a sample from 2 different prisons. They had these restrictions due to COVID, and until now, May 2022, they couldn't start with the survey. They also have some problems in regards to the presence of the security staff while doing the research, and also with the spaces within the prison, the lack of personnel. So they are waiting now to start with the reason. Hopefully they will finish by the end of July. Next, please. So I will just read the concluding remarks, and Linda can add her comments. the evidence needed is there is interest and availability to conduct research in prison, especially on health-related issues. The difficult to access the prisons is due to the restrictions due to internal functioning and logistic of prison. The language also is a barrier, as we have seen, including literacy and staff culture, the COVID restrictions, the trust between the researcher, the prison, but also between the prison and the inmates and what they want to express and what they need to say, and the need for more information and training. Linda, if you would like to add something to this.
No, I think it's exactly this the point, and I think probably once also the results are more visible and the usefulness of the result show exactly that they can be useful and effective, then probably this would help also to improve and to increase the possibility to do research and to have more evidence in prison. But I think in general there is this willing, but there are obstacles that we have to find a way to overcome.
Yes, and what I would also like to add is that our experience will be very helpful when doing the research in the framework of the RISE-Vac. And these difficulties, the language barriers, the COVID-19 restrictions. So, yes, thank you.
Thank you.
So many thanks, Josefina and Linda, for this very comprehensive overview of what's being done with the EQDP questionnaire from the MCDA and the implementation in 6 countries. Was it 5 or 6 countries? 5 countries. So we expect some 2,000 questionnaires to get back. So quite something, let's say, a solid base for future recommendations and for future planning. Please, Josefina. So are there any questions to either Linda or Josefina on what they presented? Please, Lara.
I have a question myself.
Me as well.
From what you presented, I understood that the questionnaire were distributed in paper form, and then people in prison were completing them by themselves, or were there some mediators or some support from other staff? How was it done in practice, basically?
As far as I know, in Cyprus, the teacher of the school, Iakovos, is in the group, was helping the inmates to conduct the survey, to fill the questionnaires, and also some in cases some of the inmates couldn't understand. Another inmate was there speaking the same language, and they were helping. And in the other countries, as far as I know, there were researchers and they were helping the inmates to fill the questionnaires.
If I may, I think in Belgium, no, they bought some iPad, no, for
in Belgium. Yes, and they were doing by themselves the questionnaire.
It works quite well.
So it's a mixture of different approaches, yeah, in different prisons in different countries. Okay, and how did you go through informed consent before completing the questionnaire? So how was that done? Was it done in groups of people that were, being explained and videos, or how was it done?
They were informed. There was a consent, informed consent with the questionnaire. They were in group in the school of the prison, and it was explained by the teacher before conducting the survey. So they knew what was about, and there were also incentives. We gave telephone cards to the inmates who wanted to participate. Yes, it's a motive to do the survey. Yes.
My question, has that been done in all of the countries? Let's say an incentive, like a telephone card, or what were the incentives elsewhere?
In Lithuania, they were giving like notepads, something we have also done now in Cyprus, and we are going to distribute them. In Belgium, to tell you the truth, I don't remember if there were any incentives. And now we are waiting for Greece and Luxembourg, that they haven't started the survey yet. So I don't know if they are planning to give any incentives.
Yes, Filipa, and then Romania, please.
It's just a follow-up on that, but from what I understood, this hasn't been submitted to ethics, correct, in all countries, your survey?
Yes, it has.
And it has been approved in all countries with the incentives?
Yes, yes.
Thank you.
Yes.
Interesting. It would never go through in Portugal. Never.
I have also a question regarding the methodology of collecting the data.
Mm-hmm.
So I understand now with Linda, with Lara, that the methodology of collecting the data was a mixed approach. But about Lithuania, as my understanding is a good one, they succeeded to collect all the data, but you have mentioned that the data were collected by prison security staff and nurses.
No, in Lithuania. In Luxembourg. The nursing staff will conduct the survey. In Lithuania, they had researchers.
Okay. And the nurses are from the prison staff?
Yes, but I don't know if they have a contract which is with the prison or it's with the health, Ministry of Health. Yes.
I wouldn't be very, very happy with these questionnaires, conducted with staff
from the inside. Yes,
so therefore, I have the question, what was the methodology? Because I understand that in this kind of consortium, Linda and Josefina, there are some NGOs, yes?
Yes.
So, and researchers contracted or personnel from the NGOs. So the methodology from the first beginning was about collecting the data, self-administrated questionnaires, and if it's not possible because of literacy and so on, of prisoners and language and something like this, somebody has to administrate this questionnaire. So in the methodology, was it a mixed provision on this? Because questionnaires, I repeat, questionnaires administrated by prison staff, I'm at least in what are the needs of drug-addicted persons, not other health needs. But it's a quite delicate question, I think. Thank you.
May I, in the beside the EU project, in the 7 countries that have done before, that they have done, including in their regular, most of them they do regular survey, and they included large part of the EQDP. Most of them they contracted out to some external researcher. Then the method could be like self-reported or administered, like in Spain. In Spain, I don't know if there is anybody from Spain there, but they do this large survey periodically, or they've done in Portugal also twice with external researchers. So they were not, and usually in small group. They were not directly prison staff involved in the administration. Then there was, in some cases, help because of literacy or cultural level. What we did in the methodological guidelines, but that is like, again, guidelines and this recommendation, we indicate 3 possible methods, but of course, always indicating that the researcher should be independent from the prison administration to ensure a certain level of objectivity.
Yes, and just to add something, it's that COVID-19 just changed the whole methodology. We were planning to do the research with researchers, no prison staff present, but everything changed. So we had to adapt each country to the needs at that moment. So everything changed. I know that the results might be biased. We are expecting that. But for at least for Cyprus, it's the first research done in the prison. So we are very glad for this. So we start with this, and then we will see in the future how we can progress and improve our research. Thank you.
Okay. And I think another point that is super important, but I think everybody is aware, is the preparation of the access and the information awareness of all those that should be involved, especially, the custodial staff should be aware of what is done, and I think overcome the fear of possible consequences, or the preparation. It's really important in preparing how you enter and how you conduct the research.
So many thanks, Josefina. Many thanks, Linda, for this comprehensive overview. Thanks a lot. So our next speaker will be Laura Baglietto, and she will speak about the assessing vaccine literacy, the RISE-Vac study, protocol and feedback from the working group. So we will go a little bit deeper into the methodological questions. I'm happy to hear about, let's say, our results from the discussion yesterday. Please, Laura.
Okay, thank you. Dovrebbero mandarlo loro. Non mi hanno detto che l'avrebbero mandato loro. So. Ecco, lo stanno mandando loro. Un PDF.
Okay.
Is that one? Yes.
While you're setting yourself up, just a couple of words on the link between previous presentation and this one. So we try to gather some insight from what is being done already in prison in terms of administering a survey, even if it's, of course, a different subject and different topic. But we wanted to grasp a little bit of the experience from other countries and other projects and try to feed those into the discussion that is coming about RISE-Vac and the study that we are planning to implement. Also, I'd like to bring back a sentence that Jörg said yesterday, that this project is something that you do in spite of reality. And this is what we are planning to do, in fact, to try to overcome all the obstacles. Some of those Josefina already mentioned, I think, the same that we will probably face through this project, but we will try to go ahead and show that it is possible to perform research in prison setting, as Josefina was also suggesting. Thank you.
So thank you, Lara. Thank you, Aino. I would like just to start the presentation with this slide that I have added after our discussion yesterday in the afternoon, and even as a comment to what has been said yesterday in the morning. So it's something about the difficulties is to go from the theory and the practice in setting as difficult as this one in which we are operating. And we have seen from the example that has been just exposed how difficult it can be and how much we have to compromise with what is in theory necessary to do to run a perfect study. So in our setting, we want not just to assess which are the actual situation regarding vaccine literacy and vaccination attitude, but even we would like to measure if we can detect an improvement in this attitude and literacy after we have implemented some actions. So it has more to do with measuring how effective has been our intervention. So we all know that the best practice would be to perform a randomized trials. Why is that? Because with randomization, we can cut the link that is between confounders and the exposure, and then we are able to attribute all the effect on the outcome to the exposure. And this is what randomization does. But in our context, and even in many other contexts, it is not feasible, and sometimes probably we are borderline here as well. It's not ethical to do a randomization. So which is the alternative? The alternative is to conduct a longitudinal observational study in which each individual is followed up. So the confounders do not change, or hopefully they do not change, because individuals stay the same before and after the intervention. But again, this can be difficult as it is in our context, because people enter and exit the prisons. Some of the prisons have a long stay, others have a shorter stay. So we are facing another problem. So we have to compromise again. And we have to go back to what is a cross-sectional observational study. As you will see, we compromise between the two options, and we understood with your help that it is possible to try to put the two designs together, the longitudinal one and the cross-sectional one. Which is the issue with the cross-sectional observational study? It is still possible to detect a causation, to say that an effect is a causal effect, but we have to adjust for all possible confounders of the association in order to be able to say, okay, the effect that we are measuring is not due to the presence of extra variables, but it is due to the effect of we have done, of our action. That's why it can be tricky, because we have to add the questions to catch all the variability that is in our sample, and that we cannot eliminate or adjusting for with the randomization. So this is just a little, some little observation to point out in which setting we are working and which compromise we are trying to put in place to overcome these difficulties. So as I said, the objective of the survey is to quantify attitude toward vaccination and vaccine literacy, as well as to measure vaccination status. I did not mention before that the effect that we want to measure would be on the vaccination status. But again, in this context, measuring the effect is quite tricky, because we are not sure if we can really rely on all the settings where we are operating on the data that we are collecting. People, again, are changing in each situation. So the vaccination status cannot be a good index of improvement as effect of our outcomes. So again, we have to be careful what are we measuring and how we are measuring it. So that's why we tried to develop, with your help, a questionnaire that is more even effective, as well as acceptable to the people to which it will be asked. So, as I said, we compromised to have this longitudinal design. Longitudinal in the sense that we will try to track the people, assigning to them a pseudo-anonymization code. It means that in each center, the person working in the center will assign to each person a specific code that will not be transmitted outside the premises. And the idea is to use this code before, in the interview done before the implementation of the interventions, approximately 6 months after the implementation of the interventions, and this is just to be able to assess if there has been some improving in the attitude and in the literacy, and again, if it is possible, at the end of the project. So the idea is to have a registry, to have a form in which the name and all the specific identification of the inmate are kept, and to assign a RISE ID that will appear on the questionnaire, in all the repetition of the questionnaire, and even on the vaccination tool that Davide is going to present. Yesterday, initially, it seems to be a very big issue, this one, and we went very carefully in trying to suggest this as the best approach. But after having spoken a lot with all of you, you basically all agree about the feasibility of this approach. So it seems that everyone is okay trying to keep this registry and use this pseudo anonymization approach. So the answer to the question basically, non capisco come va su e giù perché, questo. Ok, sta usando le frecce su e giù, ok. Okay. So these are all the prisons that at the moment agree to participate. As you see, there are centers in which there are more prisons participating, others where there is just one, because there is just one prison, like Cyprus. We are still waiting because of internal difficulties from the UK, the list of the prisons that are going to participate. So we hope to increase even the sample size. So for each prisons, we ask the capacity, and we even ask which is the average length stay in the prisons. And this will give us an idea about how many people we expect to be present at the follow-up, and then to be the number of people that for which we are able to conduct a longitudinal survey. At the end of the day, or in the next following day, you will receive a to-do list, and this to-do list will be directed to the person that are directly collaborating from each center. And we are asking you to check all the information that is on this spreadsheet and to add a contact name. You already provided a contact name for the person directing the prisons, but we would like to have an operational contact name, someone that that it's okay if we contact for any technical and even trivial reason. So that is what we will ask. Now to the sample size. Okay, as you see, there is a variety of size of the premises involved. Some are very small, others are larger. For all of them, there is a turnover. So after having done some sample size consideration, we came out to this number. This is a magic number that can be discussed as long as you want. We just had to make a decision. We decided that we would like to have, if possible, of course, because if it is not possible, everything will do. So that's okay to have even a shorter number of participants. But we would like to have at least 500 participants per center, or per region where similar intervention action will be implemented. So I assume, but I'm not sure if this is true, for instance, that in all the centers from Italy, the same sort of actions will be implemented, because Work Package 6 will suggest some actions. I'm not sure if all of them it will be possible to implement all of them. And I'm not sure about the modalities of implementation of all of them in each centers. Even there is the fact that the centers are difficult from one to the other for composition. And so it is good to have these 500 to be able to conduct at least an analysis stratified per center. Then we will put everything together, of course, to have an overall result. But with these 500, we hope to be able to reach a conclusion, at least, that is center-specific. Not center-specific, but area, region-specific, let's say. So we should be able, with this 500, we should be able to detect with an 80% power, and here we are going into something that is a little bit difficult to explain, in the ability to detect at least a 10% improve, let's say, in the positive attitude toward vaccination over the 6 months period. And this calculation has been done taking into account the turnover of the places that are participating. Of course, any larger effect can be detected with a higher power. So this is good. And any effect that the questionnaire, as you will see, will include questions that do not detect a yes or no answer. So it's not a binary response. Of course, this binary response, with this binary response, we assume performing some analysis like dividing into the scales of the response, maybe based on the median or based on whatever we decide to do. Let's say that a gold standard would be the proportion of people vaccinated in each centers. That would be the proportion to which we are aiming at using as a response to the action. If not possible to do that, we will use whatever we can in our questionnaire to quantify the response. One difficulty that has been discussed, and I think we arrived at a good compromise with all of you. So the languages in the master questionnaire will be provided in English. Then to each participating center, we will ask for their help to translate the questionnaire in their own language. Then we ask each center which are the other main languages spoken by the inmates in the premises, and we arrived to a list of these languages. So we are almost doing a translation in all the language of the world, but with the support of the language mediators, we hope to be able to achieve this goal. Something very interesting yesterday came out, and it was a proposal of translating not just on paper, but maybe doing a video with an introduction to the study. And this can help to as a sort of information given before signing the consent form. So at least there is no need for someone to repeat every time the same things and provide the same information, and that can be formulated in the most proper way in the video. So let's move on. Okay. Now, we tried yesterday to understand from each center a little bit too much of what it was possible to have from all of you, because we are still in the early stage in Milan as well. So I will tell which are the questions, and I will tell which is the answer from Milan. Each center will follow according to their own schedule. So in Milan, I'm not sure if everyone here has been informed, but it appears that it can reason. Sorry? Not at all. Okay, someone will be surprised. But someone else told me that it is a possible start, at least with, let's say, pilot, even if it is not really a pilot, it's a real study, in June. And questionnaires will be submitted through a face-to-face interview between July and October. So July and August will be used as a starting point. I mean, with the summer break, that would give a little bit of slow start to the process, but it will also give the opportunity to think more about the difficulties and what else. So how the questions will be asked. And the best thing we thought was to use a face-to-face interview. And that is because of the difficulties to understand some of the questions in reading, even to the difficulties that can be due to the fact that not all the inmates read in the language that are available. Some can just understand the spoken language, but not be able to read it. So in order to be homogeneous, the idea is to have a face-to-face questionnaire. In Milan, they suggest to do that in the presence of a language mediator at the time they enter the prison, or during specific occasion of meeting they have already scheduled for a social activity or what else, or during event scheduled ad hoc for this purpose. So there is a little bit of freedom, of course, that we leave with such center to organize things. We hope from the experience of Milan to provide you with some ideas about what has been done here and if it can be implemented in your own center. So again, here, the same thing that was discussed before was about the possibilities of using a tablet or a PC. And this can be even a good thing to show the video that we were mentioning before. It's not compulsory. People can fill the questionnaire while they ask questions on paper forms. That is an extra work because all the information that need to be entered in the database. Having a tablet or a PC would allow to enter directly the data. And Davide will provide later on with the details about everything. So the data will be entered in the database in a pseudo-anonymized format. We do not want to have name. We just ask you not to give us anything that can identify your the inmate. And the final database will be secured by a password, and we will try to follow every single need for security that is required. We will decide even if it is the best way to send it or to pass it by hand through a key. We will just meet your need at the time when it will be the time to share with us the information. We had to specify in the application that we did at the Ethics Committee in Pisa that we will keep the data for a period of 5 years after the end of the project. Of course, we can apply to keep the data longer. But not having specified that at the first step has been a cause of delay in the acceptance the acceptance of the study at our ethics committee. So we had to specify that. So as I said, we had the approval from the PISA Bioethics Committee. And here is the link. It will be available to you with all this information. Is a letter of approval, the protocol, the consent information, the consent form for adults and for people not adults. Some of the center are for people from 16, I think, isn't it? Beccaria?
Yeah.
Okay. So again, in the to-do list, there will be 2 questions. Do you need to make a full application or a partial application to your committee? So the letter of approval will be available to you with all the information in English. But if you need to do a partial or a full submission, we invite you to do it as soon as possible. And we are able to offer to you all the help and support that you may ask or you may need from our side. And I think that's it. I give the floor to Davide, so he will. Yeah.
Many thanks, Laura. Will you just stay there, just in case any questions will arise? Oh, please, Babak Moazen from Frankfurt University of Applied Sciences. I think just now.
So if you want, we can. Yes, it will be okay.
So now it's Davide Petri, and he will speak about, let's say, the technical issues around what Laura already presented. And we will then have a Q&A session afterwards.
Okay. Can you see even from Teams? Yes, yes. Okay. Thank you, everyone. Hello, good morning. My presentation will be on to complete the Laura presentation with the questionnaire issue and the questionnaire administration, and then with the data collection tool. So let's start with a declaration of intent, let's say. In my structure of slides, on the left side, I will present what we have agreed, proposed with Milan prisons, and then on the right side, what came up after the working group of yesterday. The questionnaire that Laura just presented contains 42 total questions, divided in these sections: vaccination hesitancy, health literacy, vaccination knowledge, intention to vaccinate, risk perception, and information on vaccination and personal information. You can find the questionnaire in paper form here on the table. Initially was created for the administration from March to June 2022. Now the time has changed, at least for Milan prisons. We will try from July to October this year to administer it. How to administer the questionnaire? Initially, we will create several Google Forms specific for with one Google account, but several Google Forms specific for each language and for each participant prisons. Then with Milan, we thought that the tablet can be a good way to administer the questionnaire. So it exists an app called Formbox. The picture in the bottom right is the logo of this app. It's an Android app designed to collect data from field to perform survey, and can be connected to a Google account to synchronize the questionnaire. So it can be used offline, and then when the app goes online, it uploads the questionnaires on the Google account. A tutorial will be created by an EP for the use of this specific app, and can be used during face-to-face meeting or during focus group involving one participant at the time with this modality. Google Forms is compliant to the HIPAA, Health Insurance Portability and Accountability Act. In fact, the admins can set sharing permissions to manage data visibility only for a person that can manage that kind of data. Advantages and the disadvantages of this modality. The advantages are the offline use, as I said. The answers are automatically registered in an online repository. It's easy to use, and there is the possibility to remote creation and modification of the questionnaire. And so the prison participating in the project just have the survey modified eventually by the principal Google account. Disadvantages, of course, you need a tablet, so you need a mean to administer the questionnaire, and the questionnaire needs to be administered one for each tablet. You cannot use, I don't know, a focus group where 30, 50 people self-administered the questionnaire with a paper-based survey. Okay, so the next part is to collect vaccination data. So inside the work package 5, the task 5.3, the development of a data collection tool to gather information on vaccination status, is on the creation of this sort of immunization information status tool to be used by the participant prisons in the project. It is foreseen, that information on vaccination, immunization status, self-reported, verifiable, will be collected during medical examination upon admission, and we create this tool. It's a beta version for the task 5.3, but it has consequences too on task 5.4 of project document, so the assessment of vaccination status of people in prison. with this tool, we can assess the vaccination status at the entrance, at the admission in prison, and then follow the project course and see if maybe the vaccination uptake raise or remain the same during all the project course. So what is an immunization information system? You all know what it is. Just a little scheme here for the immunization information system, at least at the community level. So we have the people that receive vaccination from a variety of places. These sources send vaccination records to state or city immunization information system, and then the immunization information system provide records to patients and authorized professionals. This is for the community, of course. We are in a prison context, in a different context, and often, as in the working group yesterday afternoon raised up, the things are different between prison and community context, and maybe and often they are not interoperable. We tried to define a double aim for this tool. One is a general aim, maybe more useful for the participant prisons, and then a project specific aim based on 5 points derived by the task 5.4 in the project document. So this tool used with information collected during medical examination upon admission sorry, as a first aim, general. So I used the W's of journalism. What to create a tool that can be used to after the end of the project, if a prison want to, of course, all participant institutions, when at admission in prison and in each vaccine administration, our RISE tool, thank you to Nicola for the suggestion of the name. And the other aim is project specific. So in task 5.4, we have these 5 points to remark, to achieve. The vaccination status of prison population in the RISE-Vac participating countries at the time a subject entering the prison. So I need to assess this status at the entrance. I need to know the factor associated with suboptimal incomplete vaccination status and the vaccination uptake. So the vaccination uptake at the entrance and eventually modification in vaccination uptake during prison stay and during the project course. So, and factors associated with vaccination uptake. This is the RISE tool in its beta version as the initial appear. So in the upper part, you see the logo and the instructions on how to use it. And in the lower part, on the left, you see the input part. And on the right, you see the output part. Now I exit a moment from PowerPoint to go to the app, so I show you in action. Okay, we recommend to use it in full screen mode to a better visualization. Here is the upper part with all the instructions on how to use it. You can use it by ear or open it in the browser. And as you can see, you can input the information on the left. Now let's see all different variables and fields to be filled. You can use it without the mouse. So just from the keyboard, you can move from one field to another. So the operator code is a code specific for the operator that at the moment is going to fill these variables and maybe administer the vaccine. The RISE ID, Laura told you before, is an ID composed by the country of, for example, for San Vittore, the RISE ID will be ITA, SVI, San Vittore, and a progressive number for the inmate, maybe 0001. We choose a 4-digit number for the progressive number of inmates. Then certain some variables related to the inmate, so the date of birth, gender, etc. I specify here that if the same inmate came 2-3 times to you, this when you put the RISE ID of the same inmate that we already registered, and this information are already in the database, all this field will disappear. So I have not to insert 2-3 times the same date of birth, etc. Gender, country of birth, nationality, education. So these 4 variables: education, what was your employment status before imprisonment, how many children do you have, and which of the following best describe where you live before imprisonment, are 4 variables that we can use to define a socioeconomic status value to better control for confounding in the next phases of analysis. Then the date of entry in prisons, which vaccines have you already received, and how do you know this information? Self-reported, maybe antibody titer, and etc. Date of vaccination, which vaccination has been administered at the moment when you fill this questionnaire, and an appointment part, agenda part, with next visit date that you can select, and which time. This is an agenda, so if a certain date, a certain time are already full, you cannot select it. The program make not so selectable this part. This is the part for input. For output, you see the first part, previous responses. With the scroll, you can scroll right or left with all the different variables gathered together. We can search for a specific value in all fields. You can show from 10 to 100 entries, and you can download the responses in a comma-separated values format. The other part is dedicated to the agenda, so the upcoming visits. Here you see the RISE ID, the operator, time and date of next visit. Here I have to add the field of the vaccine for which the upcoming visit is taught. Okay, let's go back to the slides. Okay, you can see it. So the input fields are this one, operator, RISE ID, you have already saw them. The suggestion from the working group yesterday afternoon are how to define if the vaccine cycle is complete. Yes, we have to implement this feature. So inside the vaccines already received, we have to know if the vaccine cycle is complete. If you just received the first dose of COVID-19 vaccine, you need to know that the inmate needs to receive the other doses, etc. The second point is multiple selection on both vaccine administered and vaccine already received. So in effect, at the moment, vaccine already received is a plain text variable. We can do it by multiple selection, and at the appointment, maybe the inmate can receive more than one vaccine. So it had to be possible to select more than one vaccine administered at the time of this questionnaire. The third point is the information on vaccines already administered outside prison, how it is assessed. It's self-reported, it's from a vaccination registry, it's from an antibody titer, etc. And the fourth point is how to communicate with external registry. This is the most challenging phase for us because we are 6 different countries, different regions, different immunization information system, both at country level and regional level. So we have we made this app with tool with R code, so it's open source. And is a code, of course, modifiable and plastic, let's say. So this is a challenge, of course, for us, but we will try. For the output, then just 2 slides. For the output, the possibility to download and store the data, easy access to all fields, etc. You have already saw all these features. So thank you for the feedback. Any feedback will be useful for the improvement of this tool. After the final implementation, we will create here too a video tutorial on how to install and use this RISE tool. It will be possible to use it immediately. It can be used offline. You need a PC, and hopefully we'll pilot this tool by the end of June 2022. So thank you for your attention.
Thank you, Davide. The questions. Babak, you raised your hand after the presentation of Laura. Would you just join us here?
Thank you. Thank you so much for all you've done so far. Very well developed. I'm not quite sure actually, but I think first of all, I totally agree with you, Laura, that cross-sectional design is the best design at the moment for this study. But you mentioned causal effects. I'm not quite sure if we get any causal effects through a cross-sectional study. You know, at some points, maybe, well, we all know that like trials, randomized trials, as you mentioned, they will provide us with causal associations, causal relationships. At some points, quasi-experimental designs will also do that. But at best, if we kind of run our study, do this, let's say, pre-post and compare the results, and if we see anything here, that would be only an association. So we can interpret it as those who got this intervention, they were more likely to get vaccinated compared with those who didn't. This is one thing. And the other point is basically, I'm thinking aloud. I'm not quite sure if it's possible. And first, it's not clear to me. Is that going to be self-administered? I mean, do we want to ask people to fill in the questionnaires, or we will have an interviewer to ask them? Because, you know, you mentioned different languages. It means that in one country, in one prison, and we need one main interviewer and a lot of assistants to translate that. So I'm just thinking, and I'm not quite sure if it is the best idea, but is there any, is that possible to design something, and for example, an online questionnaire that is already translated into many versions, many languages, and people will answer the questions, but it will automatically, the answers will automatically translate it to English and be saved into the repository, for example. This is something that, you know, I'm just thinking about. I'm not quite sure if it works. Is that possible at all or not? Just, yeah. Thank you.
Okay. So your questions are quite challenging to be answered, so thank you for asking them. So to the first question, the causality issue is a huge issue. I think that as a statistician, I would like to concentrate my work in analyzing data from randomized trials that has been designed by other people, because the most difficult part in randomized trials is to design them. But then when you have the data, is very easy to analyze them. You just do what has to be done to have an answer, and you can be pretty much sure, even if not always, that what the association that you are measuring is a causal association. But it can be tricky, that as well. But leave that on the side. For what concern the observational studies, you need to do some extra work that has to do with the modeling and with the underlying hypothesis of your model that you are trying to model. Some people can think that is a little bit of data dragging. We can talk about that. Can be true, but is the way things work. So you need to have an hypothesis, and you need to check if your hypothesis holds, and you need to see if what you are supposing is going on with your data just is reflected on the data that you are using. So is a way of compromising from what we have and what we don't. A cross-sectional study, just a single cross-sectional study, of course, cannot provide you with any information about a causal effect. Of course, you just detect association, but we are talking about 2 cross-sectional studies. So we hope that the changes during the time are due to what we implemented. And we try to adjust for the confounders, trying to take into account the possible difference between the setting before and the setting after. More than that, we cannot do. We hope to be able to use the information from the longitudinal part of the study as sort of sensitivity analysis that can be done just to check if there is consistency at least in the trend of the answer that we get from the data. But apart from that, this is what can be done. Anyway, causality can be studied, and it's a very, very interesting field, even in observational studies, but it's challenging for sure. So this is to the first question. The second one, another difficult one, the submission to the ethics after all the discussion we had has been for a face-to-face interview with a trained interviewer. It means that the interviewer are trained to read the questions and to ask them in a certain way. So questions that have been already translated in the language. So there is nothing that the interviewer or the mediator has to add to what is written down. So if we are able to train the interviewers, there will be the possibility to explain to them that they do not have to interfere with the possible answer from. But this is a normal practice in asking questions. And so for what concern the e-tool, it can be very tricky because not all the premises allowed to use online tools, online devices. So we discussed about this possibility. We prefer not to have a self-administered questionnaires because, as I said before, we have such a heterogeneity of people and skills that is very, very difficult to be sure that everyone can read and understand what they do have. Plus, there is the issue of the language, for which we prefer to try to catch the majority of the people, even if the language is not a first language. If someone is able to speak in English but does not read English, with a face-to-face interview, we are still able to get the information from this person. So that's why we went to that way. I think that at the end of the project, we will do something very similar to what Josefina was saying. Things are changing along the way, and we're trying to adapt. That will be part of the limitation of the study, I think.
And just to add a little thing, thank you for your suggestion on the translation of the answers. So if I cannot propose the questionnaire in English, maybe I want to receive the answer in each language and then an automatically translation to English. But in our questionnaire, we have a lot of multiple answers or scales from 0 to 5 or from disagree to totally agree. So this kind of issue is partial for us. So we can easily translate the scales or the multiple answers from a language to English. or just see, or just give a number from 1 to 4, let's say, and then have all the answers by numbers and not by language.
Hi, thank you. Thank you for your amazing work. It's wonderful to see it coming alive online. Just one point and then one question. The first point is, I think we've probably got to, be realistic about an RCT. This project is what we've got 1.4 million euros from. If we were doing an RCT, this would cost what 4-5 million, and would not be and that would just be for this. I mean, it would be phenomenally expensive, and I think what we're doing is probably the best we can do on the resources in a difficult environment. And when we write it up and disseminate it, we will caveat all the findings with appropriately. So I think, I think we've got to where we are now. So actually, a couple of questions. So I'm now thinking, having seen your sample size of the 500, and as you know, the UK prisons, we've got 5 on board, but we can't let you know who they are yet for various reasons. And I'm just thinking, out of those prisons that the 5 we have, one is a greater capacity than 500, and whether actually should we be saying to 4 of them, saying thanks for your offer, but actually we're going to go and find another one of 1,000 capacity, because that might be in terms of analysis.
Okay, so this is another issue. And the issue is that how much do we want to cover the territory and to capture the heterogeneity of the population. So it has to do about the external validity of the results that we are going to get. Of course, the ideal things would be to have just one center to be able to work on that. I would say that if there is not much difference between the different centers, one would do. Otherwise, if one is male only, or it's just for migrants, then it would be better to have samples from all of them. That's my answer. To your first questions about the 500. So yesterday I thought it was a little bit a lot, but then this morning Josefina was saying that their target was 400 per prison. So I felt a little bit relieved. It's a little bit more than 400, but not much. But apart from that, this 500 is the sample size requested for a binary answer. If you perform the analysis for a continuous outcome, you need much less people. Yeah. I didn't say that because I didn't want to make the impression that you can even collect 50 people. But I think that we are able to use whatever you're able to provide. So I would say that's fine. Concentrate your energy with your larger prisons, but if you can, still try to make an effort to include some from the other centers. That's my idea, but we can even discuss.
Thank you. And can I also sort of make a plea to our other partners? UK are probably going to be one of the last to complete this for COVID reasons, for ethical reasons, because we're going to have to go through full ethics, which might well take 6 months. And it would be really interesting to look. I mean, this is one of the joys of a collaborative project, that we can learn from earlier countries, because I'm thinking of actually completing this on a one-to-one. 1,000 people is going to take a long time, and whether there are sort of more other ways emerge whereby we're training up peer researchers to do it and things like that. So
yes, on the basis of the discussion we had yesterday, some of the questions will be cut. So the questionnaire, the survey will be probably not longer than a 20 minutes questionnaire, I would say, because the answers are more yes or no. Provide me with a score between 0 and 10, it's more. They are quite quick to be answered.
Yeah, okay.
But still, there is the time. Yes.
So, I have a question to the Laura, to the study on assessing the literacy and the attitude. What activity do we measure? So, we have the questionnaire administered, and after that, 6 months after the activity. The activity is the vaccination. No, what? Because
So,
is it linked
to
to the
work
increasing the
Yes.
literacy to the
Yes.
work package 6?
It is. In fact, we didn't start yet to find. Sorry, you want to finish with the question?
Yes, and the second question is if you provided to pilot not only the e-learning, not e-learning, the RISE tool on the vaccination itself, and also to pilot this questionnaire administration and in Milan or in somewhere elsewhere.
Okay.
Thank you.
Okay. So, sorry, I just was concentrating on the second one and I forgot the first one. So the reason why we try to capture these changes in literacy and attitude is because we want to quantify the effect of the intervention that will be put in place following this recommendation of work package 6. So that's why is 6, isn't it? Yes. So that's why we are even a little bit late in finalizing the English version, I mean the master questionnaire, because they are still in the first phases of putting together the advisory board, from which we hope to have the feedback before their first meeting. So they are trying to help us with the deadlines in order to be able to, so they will look at the questions and hopefully they will provide us feedback about the ability of our instrument to capture the intervention. But I mean, the information, you can have a look to the questionnaires and see that they are quite, so they are quite general questions about the attitude and the knowledge about vaccination. Please.
I want to add something also because the point is that the project was structured as if it was, let's say, well, everything would have been well timed, but this is probably not the case. So what we will measure is more, if I can use one of Iemon's preferred phrase, is the whole of prison approach. So we imagine that through the activities that will be performed, work package 6, work package 7, which is the expansion of offer of vaccination in prison, then we may imagine that there will be a change as within the prison towards promoting or increasing, let's say, the opportunities to get vaccinated. So what we are, again, hoping to measure is this kind of change. It's not only the information education material, but it's the whole system that will move towards an increased, let's say, offer or improved quality of vaccination services within the prison. So it's for this reason also, I think the randomized control trial is not applicable to this particular setting, also because every prison would go with its own, let's say, timing. Let's see what Emma has just said about UK. So we cannot imagine we all start day 1, we all end day whatever. So it's everyone will do what it is possible to be done in that setting, and we will measure what happened and hope to have some sort of improvement in the key indicators that Laura has presented earlier. So again, I think we need to have lower expectation in terms of what we can really achieve in terms of quantitative data out of this project, but still having a good base, 500 or even, I mean, less or more for different countries. We have a standardized approach. I think this is what is really counts in terms of getting a result out of this effort, collective effort.
Okay. Yes, no, the educational activity will be hopefully implemented. If you want to be able to catch a lower percentage of increase, that would require a sample size that is not affordable with the money that we do have and within the time frame that we have. So it is basically not possible.
Okay, thank you. I think this kind of follows up from the previous discussion, Laura. You mentioned very clearly today that the main intention, and that was actually the basis for the sample size calculation, from what I understood, was to capture a change in favorable attitudes towards vaccination, right? That's your main variable. Well, that was the basis of the sample size estimation, so it should be. So my question is actually quite simple in theory, although I understand this is changing. How are you going to operationalize this variable? Because looking at the survey, there are several domains, right? And a favorable attitude is, in theory, composed of various subsections. And even if this is going to be changed throughout the project because of limitations that you might encounter, I would expect this to be defined a priori, and if it is, it's not clear yet to me. Just one additional point, because this was also the basis of the discussion yesterday. And I'm happy to see that since yesterday, it has been decided that Milan is ready to start. So this is excellent to see lots of motivation and enthusiasm, but at the same time, it does raise some concerns because July is in 1 month, and you have mentioned that you still need to test the survey. I assume this is a kind of validation, but maybe not. You still need to translate. You still need to provide training to the person administrating the survey. So I'm just wondering how this is going to be accomplished in 1 step, or if any steps are going to be passed over.
No, there are a lot of people here ready and happy to collaborate. For the translation, we are not doing the job, but you all are doing the job. So I think that is some help and effort that we will ask to all of you. Concerning to the piloting, was even a question from Lucia that before we didn't answer. So there will be not a proper piloting that will guide the second phase of the study. We do not have the time to do that. It's just a time frame of the project that does not allow that. So let's say that the first time of the study and the information that we will be able to collect through the first questionnaires will be used to redirect the second the following step. And then we are even keen to discharge, as it often happened. It happened before in other studies to which I participate, to discharge some of the information that has been collected in a preliminary phase, because we had to think and to modify the settings. So yes, you're right. We are pretty strict in time. We'll do our best, and otherwise we will not be able to do much. So I think that we will certainly start with Italian translation, with English translation, and all the other translation, whenever we'll be ready, will be applied. To your very important questions about...
Laura, sorry, can I just interrupt to understand better? So you will start with the translation without validating the questionnaire. Is that what you're saying?
I mean, it's not that we do have to validate, because there is not much that has... what we can do is that to measure the consistency of the questionnaire, the internal consistency, and that will be done. It's a questionnaire that has been developed based on as we discussed yesterday. It has been changed. We will validate it as much as we will be able to do using the first data that we are able to collect. We are certainly taking into consideration this need, and I think that has to be done, and we will do that. But back to your questions, very important questions about the outcome. Let's say that the binary is quite simple: vaccinated, not vaccinated. So that would be the goal. If not feasible, we will use the median of each score that we are going to measure, creating an average score, taking the median, and saying below the median is 0, above the median is 1 in terms of binary response. This is what we will do.
So then it's not an attitude, it's a behavior. Vaccinated or not vaccinated.
Or good attitude and bad attitude. So I'm happy to, less happy to. We are not.
So it's not coming from the survey. It's not coming from the survey. It's coming from the actual behavior. Yes. Do you understand my question? Yeah?
I don't think I understand, sorry.
My question is if attitudes or behaviors, because if you're measuring behaviors, maybe you don't need this questionnaire. You just need to know if they got
For
a shot.
attitude, there are questions about how happy you are to be vaccinated and which is your feeling about being vaccinated. Though I think that there is a section about that, but maybe I'm wrong. Really.
And for behavior, we have the RISE tool. In the RISE tool, you see if the people in prison actually vaccinated or not.
No, this. Yeah. So exactly. So there will be two variables. The one is about how many people have been vaccinated in a given period of time in prison, and this will come mainly from the tool. So this is quantitative vaccine uptake number. And it may not be calculated at individual level, but it may be probably calculated at prison population level over a given period of time. And then the other one is attitude and knowledge about vaccination, which will be calculated, as Laura said, using the survey responses. So there are different, Davide showed, there are different domains. Some are about vaccination literacy, some are about vaccination attitude, intended willingness to be vaccinated if offered. So this is the type of question and the type of answer that we will get. And based on the average score of the questions, that we will be able to measure whether there has been a change at population level in the pure cross-sectional or at individual level for those subset or subgroup where we will have more than one answer over time. So this is the design.
Last question, please. The last one.
Yes. Okay. I think one of our objectives, very important, is to test and apply new methods of intervention inside prison. So my very easy question is, when will be fully available the tool? Will it be possible to apply the tool, to use the tool inside the other prison institutions apart from those participating into the project?
We will start, of course, with participant prison institution in the project. Then, as I said, the code is free. And then if the word spread and maybe other prison knows and appreciate the tool, they absolutely can use it. I think we will need maybe, I don't know, ethics committee approval for extra prison, extra country involved in RISE-Vac, but it's absolutely feasible, yes.
Maybe just the software that Davide is using is a free software. So the only problem can be to adapt it to your own need, the software. But as far as it is concerned, the software, there is absolutely no problem.
The software is open source and shareable to everyone is interested in it.
Yes. I think that there's Eva. Yeah, exactly. Eva. Yeah, also.
Thank you. So I have a more legal question. So you plan to set up a sort of a data transfer agreement that should be signed between UNIP and each partner? Because I'm pretty sure that our institution will ask for such a contract.
Yes.
So there should be information
We,
about.
we can do
yeah,
that. We have
yeah.
done it before for other collaboration. We can do that. It depends on the request of your of the single centers, but we will do that. So maybe we'll thank you for that. We will add to the to-do list. We'll add specifically if your center need a data transfer. It's fine.
And there should also be information, and this is also a question. So do we have access to our own data on the database once they are collected and also over the 5 years?
So let's say that for the purpose of the analysis will be conducted centrally, and we hope that each center will agree to wait until the results for the entire group is available. But of course, your own data will be available. And then I'm not sure which is the agreement for data sharing, but I think that it has been specified in the grant.
It's in the consortium agreement. This is dealt with by the consortium agreement, including, I think it includes data transfer or sharing of information between, let's say, not specifically data transfer per se, but sharing of information within the partners according to project activities. And this was spelled out quite clearly, but we can go through it again if you have specific needs and perhaps consider having an additional data transfer agreement if this is the case for your center.
We need it. Thank you.
Okay. So many thanks for your patience, for the vivid discussion. We're a little bit out of time, but that was quite normal because we started a little bit later. Many thanks to the presenter again.
Just have our coffee break outside in the garden like yesterday.
Dice 45 tardi. 20 minutes.
Okay, people, 20 minutes for the coffee break. Italian 20 minutes.
Thank you.
Ce-ai deschis? Ce-ai deschis?
Da, da.
So you are welcomed to the almost the last entrance at the meeting, not the last, but almost. So we have now an entrance with the monitoring and evaluating problems of the RISE project. First of all, who you are and why are you here? Are we here? I'm Lucia from Romania. I'm independent expert in Health Without Barriers, and Health Without Barriers is in the consortium with the work package in the project. And my colleague?
And I am Vlad Bushmachiu, Prison Administration of Republic of Moldova. My role in this project from my organization is project implementation, project manager, and we also co-lead and work package 3 together with University of Pisa.
And because we are a little bit late, we change a little bit what is written in the agenda. So first of all, Angela will from University of Pisa will present about the first monitoring report and also about the work package 3, which is evaluation. And after that, the work package coordinators leads will tell us in a quite structured manner about their own work packages monitoring. It's not, we have not to repeat how important is to monitor all the time the indicators and the activities and to try to change if something is gone very well or by the contrary, and to evaluate to time, internal or external, the activity. So Angela, please take the floor.
Okay, so just a few words on the report. This is our first report for the first year of project activities, and it is an internal monitoring report. Here, what we planned to do, so just a summary of foreseen reports. First year, then at midterm,
and after more than at month 28, and then at the end of the project. And we have two kinds of reports. One is the internal one, and the other is the one for the EU. Okay. So we decided to have two reports. One is the financial report and the financial plan, and each partner has to do it. And the other one is the work package report monitoring, and this is done on a work package basis. So the work package leaders are doing the report, and then we will put everything together in a general project report, which will be done by myself together with the Moldovan, with Vlad, basically. And then this, after the this general assembly will be hopefully approved by the steering committee, and then stay there as the documentation of the project. And we will maybe, I think at the moment I see no modifications proposed, but we will see if something rise from this meeting. Okay. Wait, because I have to change my presentation. Also. Okay, so the project foreseen two evaluations, one at midterm, two external, evaluations, one at midterm and one at the end of the project. And this is the monitoring of this sorry. No, I don't see anything. Okay. Yes. So basing on the program, what we had to do was to define the monitoring and evaluation plan, and we did it as foreseen in the end of February this year, and then it was approved in our steering committee meeting in March, together with the scientific advisory board, and it was updated on the financial and tender portal of the EU. Then we had communication and meetings with all the work package leaders, and we are doing now the first monitoring report as foreseen. Indicators to highlight. We received all the technical monitoring reports, but some financial reports and financial planning are still pending. So maybe if you could send them
in these next days in order to include everything in the minutes of this meeting. And this includes also the risk log for problems arised. Okay, and the next task foreseen is the is to identify the evaluators, the external evaluators. This is the task we are supposed to complete or start in these following months, because we have to select the evaluators within this June, and in April we started to ask for offers, but some evaluators we asked at the end they refused to make an offer because too much internal work or too low budget for the activity. So now we have only one offer from Cretidev. It is a Greek society, creative thinking development called. And then we have the two refusals, one from Romtens from Romania and the other one from Penal Reform International. We contacted the UK branch. And then we sent some more requests, one to Antigone, an Italian association working with prisons. And we are going to, I didn't write it because it's something of the last moment work. We thought to look for other possible evaluators in countries where maybe the money issue won't be so much a problem, because at the end we thought that this was the main problem, because we have only 10,000 euros to make these evaluations, and it is 2 evaluations with meetings, and it seems that it is too much work for some countries, obviously. And yes, so to complete this procedure, we need some more offers. Okay, these are the milestones of the project. And the evaluation plan was a little bit 6 months or more late, because the UNIP was waiting for the project manager to come, and then we completed this task, and it was approved in the first possible meeting available. And then we expect a little bit, hopefully a little delay for the external evaluation team establishment. And I hope to complete this in June before the summer comes, because then it will be more problematic. Okay, and these are the milestones for now. In terms of action to be taken, problems and corrective, yes, changes, problems and corrective actions to be taken. What we saw is that for now we don't have a financial planning, general one or shared one. So it would be maybe better to have one in order to monitor also this important part. That's why we decided to ask for financial planning for the next 6 months to have these figures. And Yes, the other one is the delay for the external evaluation, and we thought other possible solution more than looking for other experts, that would be launching a European public procurement, and the other one would be modifying the terms of reference of the evaluation to make it simpler and so to make it cost less. But I see also problems with in delay for these two more solutions. So hopefully we will stay in the research of other evaluators. Yes. No, sorry, because I had another presentation to show the terms of reference of the evaluation, but the external evaluation, but yes, it is in my computer. So, sorry. So maybe we can go on with other work packages.
You can do that at the end, if you don't mind.
Yes, yes.
Okay.
So as foreseen, as initially foreseen.
Okay, thank you very much. Okay, now I would like to invite the work package 1 leader, Lara Tavovsky. And don't forget 5 minutes each, please.
Yeah, thank you. Okay, he's opening it for me also. Otherwise I don't see it. Yeah. Okay. Yes, okay. Great, thank you. I can start. No, I can't. No. Cutie, yeah, but
It's not clear.
yeah, it's not. Yeah, exactly. No, but it's yeah. Aha, I can do it. No.
Aspetta.
No, ma non ci va.
Non si vede qua.
Vai di là, devi andare di là.
Non si vede qua. Non,
Ai là là. Here it is.
Cioè,
You can try out.
aspetta, wait, because they are things. Non si vede, non c'è. Ah, ho capito benissimo. Questo strumento.
Ah, ok, sì, hai ragione. Sì, sì, è quello lì. Ok. No, quello là. Vai. Ok, adesso lo posso chiudere. Oh, ok. Oof. Okay, finally we made it. So I'll skip this too. And we go to first work package, which is coordination. I will try to be brief just to show you what we have done and what we are doing now. So we have 3 tasks. First one is the administrative and financial management. Here we had few tasks to perform, including which is probably the one that is requires a little bit extra effort now, is the signature of the consortium agreement. So we had some here also. It was already discussed extensively with Hadea. We had some delays because of the change in name of the UK partners, shifting from Public Health England into UK HSA, and this required a little bit of extra, let's say, investigation on how this would have impacted on the project documents and particularly on the consortium agreement. But this is now solved, and we have started a round of signature, but also this is going to be mixed. Paper-based and electronic signatures, so it requires a little bit of strategical activities around who signed first. So this is the reason behind the consortium agreement. Then also the payment. This has been transferred to all partners except for Moldova, and again we are also attentioning this. Together with Vlad, because of the a little bit extra, let's say, or more complicated administrative procedures that we need to follow in order to transfer money to the Moldovan Ministry of Justice. Am I correct? Yeah. And then I think, already Angela discussed the financial report. 2 months, 9, 12, and the prospective financial plan for the coming 6 months. Then this is more the coordination part. So this is what we are doing here today. Basically, during the past 13 months, actually, as this is the end of May already, we have done we have organized several meetings, starting from the kickoff as planned, and 3 steering committee meetings, plus another general assembly, which was held last year, and then this one today. So we are, I think, very well connected, even though only virtually until yesterday. We also set up different bodies, let's say, to support us in the running of the project. Perhaps Emma will say that later, but we have a communication board, and then we have an ethics committee board as well. What else? I think, the advisory board was also set up, and I'm really grateful that all of you have been interested in this project and committed. Also to the point of spending these 2 days with us. And I know that Erika Duffel is also very keen, but she was unfortunately not able to leave ECDC because she's leading on the hepatitis incident. And of course, Linda, you've seen her already. She is unfortunately only virtually connected with us. And then the ethics and data management. So here we have, as I said, established an ethics committee board where we have 1 representative per each country, and this was meant to, let's say, support and guide all of us in the submission or preparation and submission of documents to the different ethics committees in different countries. As Laura said already, we have started with our University of Pisa ethics board, and the approval was achieved as actually by a project milestone, so at the beginning of this year already. And now we will really like to implement all other, let's say, roll on ethics committee submission to other countries. We are still in the process of preparing the management or the ethics management guideline internal to the project, and this is slightly delayed. Yeah, these are all the milestones. I think we have, besides the ethics and data management plan, we are more or less on time. And then what were the difficulties? Yeah, well, I think perhaps this is just because we only had opportunities to meet virtually over the past month. So for some partners, it has been easier, let's say, to connect and to gather data. I mean, also the group to be more cohesive among ourselves, and this was postponed 2 times already. Perhaps this has had some impact, let's say, on the level of collaboration that we managed to create during the past 12 months. But I'm sure that going forward from today, this will improve and we will be able to finalize all the pending tasks quite quickly. That's all from my side.
Thank you, Lara. Now I would like to invite the lead for work package 2, dissemination. Emma Plug, please.
Yeah, no, that's it. Yeah, brilliant. Hello, good morning again. Well, shall I do that bit? So I'm just going to rush through work package 2 and what we've done. So this is dissemination. Okay, so it's been a very busy work package to date, and we've achieved a lot. So we have the first task we had to do was the developer communication, dissemination and outreach plan, and we have done that. We've actually had this refers to communication board in February and April in 2022. They're actually our 3rd and 4th meetings. We've met twice in 2021 in July and September. So actually we've been very busy looking and approving documents and utilizing them. So everything that you've seen today, so the RISE-Vac logo and the colors and everything, these are all neatly set out in our communications plan, so that we're all singing off the same hymn sheet, so to speak. So the next task was to set up and update communication tools. So we're going to be talking about this later. The website, Twitter account and Facebook page, they've been launched and posting has started there. We're also in the process of, and sorry, I should say, we're going to talk about this, or Massimo is going to talk about this further later. So those are the big things that we've achieved, and they are, I would argue, considerable achievements. In the coming year, we've still got a really busy year or two. We've got a number of tasks. We've got research meets media, research meets policy, research meets academia, and we're going to have a variety of different events for the different audiences. We've already released, done a press release at the start of the project, but we hope to have, obviously, after Roberto's coup yesterday of getting a high-profile journalist for a high-profile Italian newspaper. Hopefully that will be our next news release, or at least something to highlight really importantly. But this is an ongoing task for the coming year. In terms of research meet policy, we're doing a lot there. We've got various things lined up. For example, at the ICRC conference that many of you will be going to next month, Roberto is going to be speaking, Roberto Monaca is going to be speaking about RISE-Vac there, and we'll be highlighting that, both of us highlighting RISE-Vac as much as possible there. Research meets academia. Again, we've got a lot planned for the coming year. We've got research meets the people and research meets industry. And I think for the people, it's very much we'll be reaching out to them, trying to use social media to contact or to influence, to inform the general public. And we'll be coming back to the research meets industry activities later. In terms of our milestones, so we had a month 2, we had a milestone to have a website. Well, we met that, which was quite I think was quite an extraordinary triumph. And it's a work in progress for sure, but it was there up with its own pages on the WEFREN website, which is something we'd always said we do. To actually use the WEFREN website that already has a lot of hits, a lot of people interested in this area as members. And month 5, we had identified our target groups and stakeholders, and that was incorporated into our communications plan. So we've met both our milestones and done that. A big tick there. Let's see. Do we want to done really? I think there's nothing to highlight there. I think it is probably important to highlight some of the changes and the problems we've faced. So we had a fantastic project manager. We only advertised and only asked for funds for a part-time post. Unfortunately, she found a full-time post, and that's what she wanted. So she left us. So that has set us back a little bit. But it's also been an opportunity, because I think we need to really increase our social media profile. And so we hope that the person we're going to appoint, I think we're interviewing in a week or so's time, we've made it very clear that they've got to have social media skills and expertise. So in fact, it's turned into an opportunity as well, because we really need to increase social media engagement. Stakeholder assessment, I won't highlight that. Yeah, and just to say, looking forward as well, unfortunately, the delay in appointing a project manager is going to set us back a little bit, but we're hopeful that we're going to keep to time. So in fact, I haven't actually put anything about, I think the last thing on the template was the the Gantt chart, and we're still intent on keeping to our timescales and keeping to our timeline, and think we can still do that at this stage. Are confident that we'll do that at this stage. Okay, thank you.
Thank you, Emma. So the next leader will be work package 4, Heino Stover. Babak is going to present. on behalf of Heiner.
I'm not terrible on Jesus to you.
Five minutes, please.
Even less. Yeah. Thank you so much. Well, just a few sentences from us. First of all, I'm presenting on behalf of Heino. We were not sure until the last moment that he can make it. So, yeah. Well, may I continue? Well, work package 4 is promoting evidence-informed policies for prison health systems. That's the title, and it's led by us, Frankfurt University of Applied Sciences, and co-led by our colleagues in France, Fadi and EFA. Well, overall assessment of technical work completed. We have three main activities in this work package. The first one is a technical report that's going to be derived from a questionnaire that will be sent to countries at national level. The data will be at national level. And the deadline for this task is month 18. The second one is a scoping review. It's mentioned systematic review here, but if you remember, we agreed on changing this to a scoping review because of the nature of the data that we're supposed to receive and analyze. And the deadline for this activity is going to be month 20. And the third activity from this work package is the guidance document on how to increase vaccine uptake in prison settings. That's going to be the last document, and the deadline for that is month 36. So we will be waiting a little bit for the other, the first and second activity to finalize the results of the first and second activities to feed in to prepare the third document. Well, probably that's only a minor thing. It's in terms of meeting deadlines, and the point is the questionnaire for the first activity is not yet finalized, and the reason for that is we have been involved in designing many questionnaires in I think maybe 4 or 5 questionnaires from the beginning of the RISE-Vac project, and we thought maybe it's, that's going to be, what we're looking for is basically is going to be gathered through one of these questionnaires, the last one, but it's not like this. We will get some of our data from these questionnaires, like for example the one that that was sent. I mean, the WHO questionnaire, for example. But yeah, we put this activity on hold to be able to finalize our kind of prepare our presentation for yesterday on the preliminary results of our scoping review, and we will finalize this question as soon as we are back in Germany. So basically, we don't see any barrier to meet the deadline. We will try our best to finish this activity on time on month 18. This is maybe the only minor problem that we are facing with at the moment. And as you can see here in the Gantt chart, maybe the only change that has been occurred here is month. As you can see here, if I'm not wrong, it's month 6 was supposed to be the deadline to finalize the questionnaire. It will be modified, and I think month 9 it was a deadline to submit the protocol of our systematic review to Prospero, and we changed that to scoping review, and we don't have to submit any protocols to Prospero anymore. That was from our side. Thank you.
Thank you, Babak. Now I would like to invite Laura Ambaglietto for work package 5.
Okay, there is not much to be added to what we already said. We are projecting to go straight to the timeline, and here it is. Okay, to the slide about the milestones that we had. We already had the opportunity to discuss them this morning. The first and only milestone that we met is the one about the submission to the ethical committee, and for that is the last the 5.3 point. We were just 1 month in delay compared to this, what was scheduled, and the delay was due to two internal issue. We had a bioethics committee that meet every 2 months. And they suggest that to modify the submission, and then we had to wait another 2 months. So because of that, I'm telling you that because you can face the same difficulties at your centers. So please try to do whatever is necessary just starting from now, because from our experience, it is, I mean, 2 months for our schedule is quite a long time. So if you're able to move on with all the submission, it is a good thing. The second point is the vaccination questionnaire. As we said, we drafted it a while ago. We circulated it. We asked to everyone comments. We received some comments. We didn't receive some comments from some of you, not from others. So again, I would like, of course, to recommend to all of you to answer the email that are forwarded to you and sent to you. I know that is a difficult task. So maybe we can find a better way to act like I'm not sure. Now we have asked to each center an operational contact to be able to contact this person and just sending to this person all the requests that we have. Maybe it's more effective to target one person that not the entire. So we are trying to have to put in place a different approach to have a feedback. So the questionnaire, as you can see, has been put in place. It's been assembled. We received comments, but we are still waiting for the final feedback. And another issue is the overlapping with our timeline with the timeline of work packages 6. So we are trying to do our best to finalize the questionnaire as well for the piloting as well. Just to add to what we said this morning, the piloting will be done along the way, because we cannot afford to ask people to be involved in such a huge effort without keeping what we get from them. We cannot ask 50, 60 inmates to answer a questionnaire and to use it simply for changing a few words. So we prefer the approach of using an instrument that has been developed by others and try to modify it if it is necessary along the way, with all the difficulties that we discussed with you this morning. Plus, I can remind you that we asked you a few months ago to try and pilot a few interviews in your centers, but unfortunately, it has been incredibly difficult for you to do that. We perfectly understand that, because working in prisons, of course, for people working in prisons, I understand that the process through which we are building the process, the project is not a priority. The results are a priority. But I know that day by day you have a lot to do. So we are trying again to collect all the feedbacks as long as they come. For what is the registration tool, we are a little bit behind with that as well. And we added another person that is helping Davide with the practical things. And so we are moving along on that step as well. So that's it.
Thank you. And Emma, once again, for work package 6.
Brilliant. Patience. Fantastic. It works. Yeah, brilliant. Okay, so hello. Sorry, it's me again representing the UK HSA. This time our partners are Frankfurt University, so in shorthand that's RISE-Vac and Heino. And this work package is about increasing vaccine literacy among prison staff and people living in prison. And just to give you an update on where we are, although I think the headline is essentially that this is very much a work package rather that's about to kick off. So what we've achieved to date. Indicators. Yeah. Okay. We've got. Let me just go straight to our milestones then. Okay. So our milestones are essentially the establishment of two international reference groups. One for the resources, the teaching resources, the training resources for staff, and that's custodial and healthcare staff. The other for the people living in prison. So two separate reference groups, probably with some common membership. And essentially, we're getting there. We have a list of names, but I think we need more people to join those reference groups, and that's going to be an iterative process. And actually, the workshop yesterday was so helpful. So we will be contacting a number of you to invite you very specifically to come and participate in our reference groups, because the feedback we had in the workshops yesterday was incredibly helpful. There's a lot of wisdom out there, and I'm very grateful for everybody. But it does mean some of you will be approached by us to join our reference group very formally. So so we've had no other deliverables. Essentially, we had the milestones of setting up the group at which was at the end of last month, and that's a work in progress. And just looking for all the deliverables that we've got, or the things we've got to do in the coming year. Again, one of the problems, the big delay is or the thing that is holding things up from moving very rapidly is the lack of project manager. But we hope to have that sorted in the next. Well, we're interviewing next month, and we hope to have them appointed in the next month or two. So, work. Okay, I think. Yeah, project manager. I think probably we're short of time. I think that's it. Let's leave it at that. We've met our milestones for reference group. We're going to be delivering these 2 packages. I think the key thing is we've got month 24 is when we've got to have the package for the staff. Month 30 is when we've got to have the package for the people living in prison, and we're still on track for that.
Thank you, Emma. Now, I would like to invite Roberto Ranieri for work package 7.
Can you hear me? Good morning to all of us. Again, our work package 7, developing and piloting models for vaccination services delivery in prison settings. We have as co-leaders Cyprus and France Montpellier. Okay. Very fast. Point 2, well, our team was completed with the enlistment of 2 figures, and a nurse dedicated to the creation of vaccination center, particularly to motivational counseling and so on, and the administrative figure, very lack of them. And point 4, we need the approval of the ethics committee. We presented all the documents with help of Lara and University of Pisa, and we hope in not so fast approval, but I think it will take 3 months average, because all documents are completed. And our partners in SPH filled out the questionnaire of models of care and the infrastructural situation of our prisons. We have a milestone on month 15 on collecting and reviewing of the model of protocols of vaccination published on the website, and for development for the tailored models. And we are collecting and reviewing the models presented and preparing the document. We hope by the end of August 2022. These are our deliverables that are foreseen for the month 34. There are 2 deliverables. One concerning the feasibility of a tailored vaccination service. The second one on creating the models for transitional care, on to create a linkage from vaccination center inside the prison and outside the prison. It's a topic, you know, very, 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 very hot of this project. We overcame the financial issues we had at the beginning of the project, and we have actually a risk of overspending. We have to model our budget considering the organization of this meeting. And we are working, have been working to create the model, our vaccination center in San Vittore, linked to vaccination center to San Paolo Hospital. We have had already some meetings with the colleague of the external vaccination center in order to establish the model and the possible connection, clinics and telematics. So.
Thank you, Roberto.
Now hoping that Angela and Lara will succeed to manage and to put together all these a little bit, let's say, gaps, not having manager in UK, not having the correlation between the budget and the expenditures to what all the packages and disapprovals and all the things. We have to continue, if possible, a little bit. If some of you, do you have some inputs on good practices or challenges or solutions found to this, do you know, challenges? If some of you, do you want to share with it was provided a group discussion of this, and now we have to make shorter this entrance. So do you have anybody of you something about to say more than it was said about challenges and the solutions figure out to overpass these challenges? Do you have? No. So perhaps me, myself, I want to follow up what Heino said in the morning about preparation. When you want to enter, I have a huge experience in this. When you want to enter in a prison and you do not have this experience, it's much better, from my point of view, to put on the list all the persons you want to enter there and all the activities, even perhaps some activities you will not envisage to do you know, but to have to approval for these all persons, all cars, all activities, all approvals needs, because otherwise you will be stopped a little bit because it was not written in your asking to do something in the prison. So, thank you.
And because we are well behind the schedule, I would like to close this session with the following. Regarding the external evaluation, I would like to ask all of you, on behalf of the sake of the project, if you know, you can recommend any companies, person who can help and can provide an offer for that, please do so, because we are running out of time. So Angela, it's there. You have all the emails, so please do so we can succeed in time. Thank you very much for all your inputs. Thank you. So now the session is closed.
Good afternoon, everyone. I think we are getting to the last technical session for this meeting. We'll go through it. We have 1 hour, and this is a very important session, I believe. This is for the dissemination activities. And so far, I think a lot have been done through the implementation of the work package 2, and many of the foundations have been laid already. And it's very important to discuss among the meeting participants on how to improve the visibility of this program and also to ensure the engagement of all partners and countries engaged in this important project. So this is the session we are going through for the coming 1 hour. And my name is Ihab, and I'm a medical epidemiologist. I'm specialized in the epidemiology of infectious diseases. I work for the United Nations Office on Drugs and Crime. I'm the focal point for prison health in the head office, and I'm based in Vienna. And I'm also a member of the Scientific Advisory Board. I'm honored to co-chair the session along with my colleague Fadi. Fadi, please introduce yourself.
Yes, thank you, Lara. Thank you, Roberto, for this the best session of this 2 days meeting. Co-chair with Ihab Salah. My name is Fadi Meroueh. I'm doctor in jail. I'm head of health unit in the prison for 25 years now. And I am here on behalf of the Health Without Barriers and CHU de Montpellier. I am involved in the 2 work package in this project. And I hope that this session we can try to have a solution to disseminate, because we can work together, but if we don't spread, we don't disseminate these works, it's damage.
Thank you very much, Fadi. The way we're going to run this session is 2 major components. The first one is presentations. We have two different presentations. Then we will leave time for discussions. And I think it's very important to encourage, I would like to encourage every one of you to participate actively on how to improve the visibility of the program. That's very important to hear your vision, insights, and views as well. So without further ado, I would like to invite the first presenter, and it's about the dissemination activities. And we will also hear some feedback about the working group we had yesterday on the visibility. The first speaker is Robert Monarca. Please, Robert, the floor is yours. You got slides?
Sono Romanelli. Massimo, hai dato la presentazione, sì? Sì. Ok. Possiamo avere la presentazione? Presentation of yesterday. So I take the time to thank our distinguished chairman. Thank you, Rob. Thank you, Fadi. I'm here on behalf of Health Without Barriers, which is the European Federation for Prison Health. And I'm very happy to be here. I have been the former president. Now the current president is by me, is Fadi Meroueh. And so it will be a shared presentation. I will begin, and then Massimo Romanelli, our project manager, will go. It's the wrong presentation. It's about work package 2.
Aspetta, non è quello.
Presentation. Okay. as I told you, it's a shared presentation. HWB, Health Without Barriers, is a co-leader which supports UK Health Security Agency in leading the project. We are not ready. Yeah. Okay. So, work package 2 about dissemination. As you can see, we started to work in the first month. We will end the work at the end of the project with the final conference. As you can see, also all the participants, all the members are involved in this work package. So I take this occasion to sensitize or to stimulate you all to give inputs, reports, news, everything you can do for disseminate the project, send to us, and we'll collect and then spread and raise awareness and disseminate news of the project. No. Sorry. So, what are the objectives of the work package? We have many objectives, very important. The first is to develop and implement a communication, dissemination, and outreach strategy, ensuring the widest possible impact among major stakeholders and key target groups, to disseminate the project by engaging and informing public authorities and policymakers about the benefits of models of vaccine service delivery and practices developed by RISE-Vac, to raise awareness among civil society and general population about the value of vaccination services in prison, to increase vaccine literacy and vaccine uptake and reduce health inequalities, to make RISE-Vac results widely known in the scientific community, and to ensure collaboration and cooperation with other initiatives related to access to vaccination and vaccination policies. Our activities, what are we working on? Yes, working package 2 will design, implement, and monitor and assess the dissemination, communication, and outreach strategy of the project. It will also ensure that the project's results are fully exploited and widely disseminated. The working package will lead on the organization of project dissemination events by taking advantage of already organized or planned events to disseminate RISE-Vac work. For example, we already told you about the first World Conference will be in Geneva at the end of June. I will disseminate the project there. WHO conference, the Health Without Barriers second European conference in November 2022 in Lisbon, and other specific project events. About the task, you have already been informed by Emma. I don't want to repeat so much about the task, but you see, we reached the first task by appointing the communication board. It was done already in June 2021. We did perform a stakeholders analysis mapping in September 2021. And we manage and setting up and updating communication tools as the website and the social media channel. About this and about the research meets activities, we are encountering many some problems, let's say, but that will be the point addressed from Massimo Romanelli and from Emma at the end. The deliverables. Deliverables 1, outreach, communication, dissemination strategy, done in month 5, including project key messages, risk medium plan, RISE-Vac, visual identity kit, logo, graphic, charter, templates and guidelines for writing abstracts, policy brief, and research paper. A communication tools, set up and maintenance of project website and communication tool, among which initial leaflet and final leaflet. And then we will write 2 reports, important reports, at month 16 and at the end of the project. And we will organize the final conference at the end of the project. The milestones, yes, we had 2 main milestones. We met already the 2 milestones. Project website completed and online on month 2, and the target groups and stakeholders were identified on month 5. Among the deliverables, I already told you that we have some critical points, critical issue about communication strategy and social media strategy. But now I would like to give the podium to Massimo Romanelli, which is deeply involved in solving this kind of this kind of problems. I hope it will go deeper inside and letting you know what all of us can do to help to reach the goals. Thank you.
Okay, so thanks to Roberto and Emma that introduced our activity. So as you know, we have a shared folder in Google Drive. I hope that everybody is going to use it, to download, to see, to check everything. So I invite you to see all the documents that are there. So you know that there is this kind of instruments, and there are the 2 documents, the baseline for our strategy, a communication strategy, a social media strategy that have been approved and by the communication board during the 4 meeting that we had. I don't know if you I plan to present a little bit this or represent, or just to focus the part of social media, but the communication plan, social media plan are really linked. So I hope that you can check and see what we decide to do this. So the part that I was more involved is the social media strategy, because it's quite new, at least for me, and that is something is currently evolving, even for the communication plan of the European Commission. What is the behavior of the European Commission against the social media strategy and policy. Also, during this period, 2021, the vaccination issue was faced in different ways. In Facebook, specifically, I can resume to you that we had some discussion about the way we want to promote our project by Facebook, because in Italy, especially in Italy, there was a strong discussion, a lot of arguments on this issue, and was used by the Novax people, let's say, against vaccination. So now in the last communication board, we decide to apply to create a web page on Facebook, but Facebook is a little bit different approach, a little bit difference of manage this kind of communication because we need a profile. So I go through this point because I know that is quite complicated. So I can just go. Sorry, I just go through the website, but the website is not an issue because the website we have the chance to be hosted by WEFR and the website. This is an important asset that we have. I put some figures. I don't know. Probably is a little bit. I'm going to enlarge by presenting. It is there. Yeah, there is the analytics of our website. You can see there are during the last months we have some high attendance, let's say consortium members, events, work packages. So we have to improve also these parts. But I think this is linked. It is a consequence for what we are going to promote in other media. Let's say how the people can check and go through this website. The communication strategy. I see. So again, I invite you to check this communication strategy because. Also the table 2 audience, stakeholder, action, and time scales are there. We have to work everybody on this matter, on this task. So it's the base for our promotion, for our communication, and then I go through the other two. Matter that I'm dealing with, and it is the Twitter account and the website. Let's say it's the web page on Facebook. So the first part, as you know, we have a Twitter account. Twitter is a different strategy of communication, so you can tweet. Actually, currently are managed by Health Without Barriers and UK agency, HSA agency, with me and Alicia, that mainly we are dealing with this kind of activity with the user, with the account. I knew now that we will have another resources probably that have some skill in managing this, but the fact that we experienced during these months, that we need your help, your collaboration, because we have now around 30 followers. We are following, they are follow us. That is the strategy is to follow each other, and are institutional, mainly institutional user, institutional profiles. So the strategy is if you tweet or retweet our post, you receive the same treatment, let's say. So I invite you to check and retweet and put like your heart in the website and try to increase this number of followers, because we need that this objective, let's say. We have specific objective, our stakeholders, decision makers, but also general public. We have also this kind of activity, and that we need to increase our visibility on this social media tool, and this is something that is starting to be active, because we started from this. I can check. I can show you for the people that don't know yet. What is it? This? No, sorry. is this. This is a Twitter. So this is our page. We have a strategy. We have a program, a plan how to post. So we post, for instance, this morning we post our live streaming assembly. Yesterday, YouTube live streaming assembly. So we have a program mainly, you know, because you sent me your photo of the team. So we have a calendar where all the activity are planned, and then we are going to respect this activity, but is a sort of, until now, a sort of presentation of teams. Now we need more posts or news. That's something that could be appealing for the people that's going to check and to follow. If you see, we have main information on the bio of our Twitter is in Italian now, but it's automatically in your languages, or in English, I think. Sorry, it's in English, but there could be a translation. So the basis in English is going to be translated in your languages. And then you have the website, and it's something that promote our website. And we are following 28 profiles, because are institutional, a user profile, individual profiles, and we have 26 followers. So it's not so much, but it's a good start. So we decide to start with the institutional, mainly the institutional profile, but we can increase with the other. And then, if you probably know, there are some common.
Massimo, how many people have Twitter?
Yeah. So
and how many person follow RISE-Vac?
Yeah.
Not
so much. So we have to promote. So we need your help, mainly to promote, to retweet. If you see, there are, for instance, for this we have 6 retweet, 6 like. Is not so much. We have to increase this.
Sorry?
Because science fiction.
No, also the other. The team, no one retweeted this. You have to retweet the 5 likes. So I'm kidding. I'm just, you know, because we need your help, really. This, yeah, you have to. This is important promotion about the WEF, about this publication. This is, but it's not, you know, popular. Let's say. Also, my daughter says you have to be more popular. Okay, I try to be more popular, but it's not easy. It's not easy to be popular. Okay, so you can see. No, I don't. I cannot say. More than 200 anyway. It's something, but I don't want to investigate too much. Who is following her? I have 2 daughters anyway. Yeah, the other. So but the pictures are nice. So I'm waiting for your likes. Okay. So this is RISE-Vac. So you have to check. You have to promote our activity. This is the other point. It's quite important now. So I'm really focused on your I need your support, because we have 6 friends at the moment. 6 friends? No, come on. It's a serious thing. So we need at least 10 to start with the web page linked. Okay. So if you go there, I have is our web page. And I ask to you, lot of you, who has a Facebook profile, to be our friends, because I need to invite 10 friends at least. You see, set up your page for success. 1 step left. One step left, it means that you invite 10 or more friends, but the minimum is 10. And we are 6 at the moment. So I invite you, I send you message, I send you by messenger. So Facebook is normal. It's not so popular as institutional web profile, but European Commission has a web page, let's say, on Facebook. I'm following. I yesterday asked a support. You want to say something?
I just wanted to say, as I said.
Yeah.
Thank you very much for this. Yeah. I mean, I'll say the same as I said to you yesterday. First of all, please check with Hadea what you can do. What's the framework? What you can do? Maybe you already did that. But then when this is done, I guess that Hadea could maybe, and now I'm speaking on the control of Hadea, but I can also help myself. That I mean that we might maybe be able to have some support from the Santé communication unit. I will check with them whether they are able to maybe retweet some of your messages, something like this. I mean, I'm speaking a bit out in the blue because I also need to check what are the options. But I mean, you do need some more friends, that's for sure. And I'm not into this at all. But we do have a communication unit, and I know that we sometimes retweet what our projects or our initiatives are doing.
Yeah.
So, yeah.
Thank you very much. So we need mainly, I have a clear idea about this. So we need that they are going to follow us because they can follow us. This is complicated. This is for Twitter, if retweet 2 or 3 times our tweet, that's European Commission has 1,000 of followers. And friends, of course, and the people that like. So the step is that once you have the web page linked, not the user, because the user linked to a person. Now is the mail of a RISE-Vac. I can go through the.
But this is something that you would then need to discuss with the communication colleagues, how this can be done. And then I saw that you very nicely, you do put the funding which needs to be there. Yeah. I do not know whether you need to put
name RISE-Vac. That is, from this we can start. So we can promote, we can even promote by advertisement and some action that we can increase. So when we will have a acceptable number of friends and people that will follow our web page. So we can ask the European Commission to help us and have also the content. What kind of content? Normally, we thought that in our strategy to post something of new or appealing, but is linked to the project. Then we can check what kind of in the next communication board, what is our strategy to communicate the result, because normally. You cannot be like press agency, but we are press documents, something that would be interesting for our public, general public and stakeholders. I think that this is our strategy. You want to add something?
Do you have some slides? Or
no, actually, it's I really invite everybody from this point. So like our post, retweet, share our post, and send us your contacts and accept our friendship or just.
Yeah. Thank you very much, Massimo.
Sorry.
I would like to echo you and inviting everyone to leave the visibility of the program.
Massimo.
Our next speaker.
Okay. Sorry.
We have one question by Paula De Capito by Teams.
No, we have something. Emma should close.
No. We have some time for discussion, so let's finish the presentation, then open the floor for discussion, if I may say that. Emma, I think the next speaker.
Yeah. Was it yeah. Okay.
It's interesting what Lara said this morning. So it's interesting what Lara said this morning about actually now we've all met together in person and we know each other, whether it will strengthen that spirit of collaboration so that that RISE-Vac ceases to be the lonely child in the playground with no friends, and that with all your input, we suddenly, we're the most popular child in the playground and we have lots of friends. Everyone wants to play with us. But that really does need your input. So thank you very much.
Ok.
Non riesco a chiuderlo, sai, mi sei parlato.
There is a question on Teams from Paola.
Okay.
Paola. Can we take it now?
Paola?
Can you hear me?
Yes.
Yes.
So first of all, I mean, it's already good afternoon to everyone. And I have another chance to be there. I will be very short on the point about communication activities. Absolutely, I would like to stress that you need to better follow the indication that you receive during the kickoff meeting, but also in the grant agreement about EU visibility. So you need to make also available the indication of the co-funding and respect the rules for that. It's very, very relevant for us. The agency can support in publishing news. We have a Twitter. We have also our communication team. And for example, I could have advertised this meeting beforehand. I didn't do it because it's a closed invitation, so it's not open to the general public. So I mean, I would prefer you to create interest, and I know that you have also the press behind, and I would absolutely make a point immediately after the meeting, if tomorrow, if you are available already, to see what kind of launching you are organizing, and then we can maybe discuss even with DG Santé if you are going to post something via the social media of the Commission or via the newsletters of DG Santé, the newsletter of the EU Health Policy Platform. So there are options. But the first requirement is that you are giving the right visibility to the Commission that you are receiving funding. The second point is the dissemination plan. You achieved your communication plan. The strategy is not really there. Why? Because as you are stimulating now in receiving inputs, it's very important that you have an outreaching strategy. It's not enough to identify messages and channel. You need to identify how you are going to reach your target. And from this point of view, I can confirm that HADEA is trying to give you quite much visibility. Also, I mean, the presence of DG Santé in your meeting is already a sign that the Commission is next to you. And we tried at least with the inter-service at the inter-service level even to make the project visible. I mean, you may remember that the project already presented in a quite early stage in the Health Security Committee. So these are the kind of things that the agency can support, and in our feeling we are already doing. We can do more. We need to discuss about this. So I just would like to confirm my availability to further discuss, and maybe once Martin is back, we can make a triangulation out of it. You may also remember that the launch of the project was something very specific, very peculiar, which gave you a high visibility. It was a joint launch of the project together with others. We try to support also networking with other funded actions, and I don't know what is the stage of communication with other projects, but this could be also a mean for you to be more visible. And so just to confirm that I'm available, as said from the beginning of the project, to commit to support you in the best ways possible and more if necessary. Thank you very much.
Thank you. Thank you very, very much. Very valid points. And maybe I would like to invite Sylvia, the last speaker for this session, I believe. And thank you very much. Sylvia will speak to us on the potentials for synergies in disseminating and advocacy efforts. No, thank you very much. Very interesting.
Sì. Vabbè, ma non è questo. No.
Non è questa, non è questa.
C'era
Non è questa.
Non è questa. Era quell'altra che avevamo aperto, vedi? Actuvax. No, Actuvax. Sì.
Questa qua che stiamo aprendo. Da un errore.
Dai, ok.
Eccola, questa.
Eccoci.
Questa. Grazie.
Okay, sorry to be the last one, maybe, but in any case, I think it's worthwhile to give you some clue, since you all know that we are running the same a twin projects. Okay, a twin projects. I'm Silvia Deklic, and so I'm talking on behalf of the Actuvax for NAM that that is okay. So that is access to vaccination for newly arrived migrants. Okay, so I will give you a few indication about the project and I try to thought about synergies, possible potential synergies. So this is a twin project in the sense that was under a global call. Our call was for newly arrived migrants, while yours was for prisoner, but was increased access to vaccination. So we started at the same date as you, and we will end at the same time. So really we are twin. Our countries, the countries involved are 8. There are 3 that are in both projects that are Italy, Germany, and Cyprus, if I'm not wrong. So we have a mixture of partners from non-profit NGOs, National Health Institute, and universities. The general objective is to improve the vaccination literacy and access, and thereby vaccination uptake for newly arrived migrants, making access condition more equitable and guaranteed. So the project involves all vaccine preventable disease, especially that are part of the National Immunization Plan, adopting a life course approach, and obviously the COVID-19 vaccine has jumped in. So if for us, the focus is to find solution to overcoming system barriers. And so we focus on the system barriers as well as the vaccination literacy for us is we are interested in the institutional or the system-based vaccination literacy. So for health or social care professionals who work with NAM, including non-medical personnel. We will also try to identify and develop flowcharts that will be country-specific, but will pilot intervention and different tools. And also we'll try to show that reinforcing networking capacity to address vaccination literacy and migrant sensitivity will help the system to increase the uptake of the vaccination for newly arrived migrants. So our target are the professionals, and we call it professional for health, meaning that is not only health personnel, but is included social workers, cultural mediators, and personnel working with NGOs. Is not NAM are not our targets, but are our beneficiaries, in the sense that we will try to focus on the system, on the staff and the personnel. The newly arrived migrants, we develop an operational definition because it doesn't exist, and we utilize as a principle a public health principles. So first of all, any kind of, in terms of on legal basis, any kind of migrants, documented, undocumented, and so on. Not only migrants coming from third countries, because vaccination is an issue also for those coming from EU countries that has difficulties of accessing the vaccination system. And we try to frame at 12 months, so for the newly arrived is coming in the last 12 months, even though it's very difficult to put a time limit like that. So, well, stakeholders like this. So we already finished the work to develop a conceptual framework, a scientific basis to both on existing immunization guidance, the reception system, and the vaccination offer, and also to try to characterize the system barrier and identify possible solutions. I go quickly because it's long. I want to show you this general conceptual framework we develop, because this is still not at country level. We divided the vaccination process in hubs, because maybe in this way it's easier to focalize the barriers, the problem, and to find solution. So the first hub is the entitlement to vaccination. Are the NAM included in the regular planning of vaccination offer, in the vaccination plan, in the COVID vaccination offer or not? They are allowed or not? Then is the reachability, how we reach the people that we need to reach. And obviously the proximity approach is and strategies is very relevant. I talk with you also during these days. You need some time to go and ask them to come or to move a mobile clinic to the place, and like that. Then obviously you have to find way for make NAM adhere to the offer, and here it comes the understanding, the hesitancy, and the needs of providing right information and so on. Then there is a matter of achievement, realizing the vaccination or the vaccination cycle. And obviously there is a matter we discussed together of evaluation in terms of numerator, denominator, coverage, and also which of the step of the hubs has been not successful if the vaccination cycle do not arrive. So this general framework is almost done, will be available, and maybe you can pick up some information also from this. These are questions under each, and then we work on, because there are also solutions that we found. Then I highlighted, this is just started, this work is to make the health system vaccine literate. And so what we will do that maybe can be provided to RISE-Vac will be the development of a glossary of essential vaccination terms for non-medical staff. And this will be very light tool translated in the 8 countries' language and in 5 languages more often spoken by migrants in that. So there will be translated in several languages. And this can be helpful. It's thought for cultural mediator, for linguistic mediator, to understand the terms and to explain to the migrants. So since in prison there are so many, it may help also for you. Also, we will produce materials and tools for training of vaccination literacy and cultural competence of the staff. And it may, we have to see if the timing of producing and translating for us will come nicely with you, but we may exchange some of this material. Finally, this will be more, for us, will be more try to create, develop this flow charts that will be country-based. And this probably will not fit with RISE-Vac, but the idea is of having also a repository of tools, of material, and so on. And this may be of help because if we are talking about vaccination, maybe among the materials you want to produce or develop for the inmates, foreign inmate, it may come nicely utilized. And also this is going to be developed, so the timing we have to cross-check between us, and then we will pilot in the 3rd years the things. Then I try to twins project beneficiaries that are very close, migrants and inmates, are both vulnerable, and there are many inmates that are migrants. Some common countries. So to me, some results and tools can be shared between the projects. I thought to bring to those that will work for the vaccination literacy baseline survey, your questionnaire, just to show them and to see if they can utilize part or like that. And vice versa, the one that I describe, I can make available and you can utilize. In terms of dissemination, these were the ideas that I thought. So obviously that we can announce each project on the other project website, maybe inform through the project social media. And I've not understood if you have a newsletter. We are having a newsletter, so we may inform also through a newsletter. Then there are other things that I'm not sure that, for example, if it makes sense to share a stakeholder mapping or not, we have to think about just to capitalize. If there can be done some common dissemination events like EU Information Days or National Information Days, if we can do some common conference presentation, some common presentation at conference or workshop, we may send abstract or other that are joined, and also maybe we succeed in having common scientific articles. In terms of advocacy, for sure is important. On the right side, there is a policy brief that we developed while we were writing the two projects with Lara on vaccination for migrants and refugees during and after COVID-19, and we put reference also to inmates, even if it's not a product of the two projects, but was already an effort to join. On the left side is another effort that, as you know, there are many vaccination projects under EU funding running. So there was this proposal to write a common call for action, and so many apart for us, Actovax and RISE-Vac projects participate to this manuscript, also the Munion and JUICEvax project. So the idea is really this time, probably even with the kickoff that we had with the organized by the Commission, the joint, there is these efforts to try to capitalize and to advocate for all together when there is a reason to have a stronger voice for advocacy like this. So, well, this just I saw that you were saying yesterday, no public health without prisoner health, and we are our saying is no public health without migrant health. So it's obviously that we are on the same basis. Thank you very much.
Silvia, thank you very much, Silvia. Very informative presentation. I would like to thank you for this. And I'm not sure if we have a few minutes for discussion. So yeah, and it is important to everybody to engage in the dissemination activity. And I'm not on Facebook, but I kind of active on Twitter, and I will be sharing more and more all these posts on the Twitter account. One observation is though, Massimo, I noticed that the number of followers is not that big, but on the other hand, you are not following many people. Maybe a step forward, I'm not sure, but if you start following people, they will follow you back, and you have to pick up your targets so you can increase the visibility through increasing the wide base of followers on Twitter. I believe it's a very potential and strong advocacy tool. Maybe my co-chair, Freddy, take us through the discussion.
We have a last point. As you know, the project has said it will engage with industry. And the question is, which industries will RISE-Vac target, and how will they engage with them? Yes. Excuse me. Yes. The last point is ethic point.
Yeah, about
Emma?
industry, we actually covered this in the workshop yesterday. We looked at the industry and we sort of had agreed that it would be pharma, and really the purpose would not be to get their money, but just to raise awareness. So that was a really helpful discussion we had yesterday. So thank you for that, everybody who participated.
And which industries you have?
Just pharma, so pharmaceutical. But the other, sorry, but the other important thing I think was about engaging with pharma, perhaps at reference group level or board level, steering committee level, but that we didn't want to pick out particular pharmaceutical industries, and therefore looking for a body whose name I've forgotten that actually represented all pharma, but clearly treading carefully.
Can I say something? It's not specifically on this. Is I think Vaccination Europe or Vaccine Europe, the name of the pharma conglomerate that deal with vaccination. I would like to thank Sylvia because she showed few points of contact between us and their project, and I think it's something that we should keep in mind going forward. Way to build on these synergies in order to make our voices heard, and particularly because we look into vulnerable and marginalized population, even if they are different, they are very much similar, and in some cases they are even overlapping. I mean, you've seen how many migrant people were in San Vittore during the visit yesterday. And then I have a question myself, actually, that we didn't have time to discuss yesterday in the working group, but I remember we discussed in a previous communication board about the opportunity to engage more with prison institutions, like Europris was mentioned, I think, by Vlad, if I'm not mistaken. And I wanted to ask you, how could we pursue this road, and if it makes sense also for prison department to share information in the, let's say, we always talk about scientific area, scientific conferences, which of course is our sort of main interest because this is our background. But then I'd like to ask you, as this is a partnership that is made up of very much different constituencies, and I'm thinking whether it would make sense for you also to spread the word in your constituency networks. Yeah, thank you, Vlad.
Yeah, it was mentioned by me. Regarding the Europris, I think it's better to ask our colleagues from Cyprus because they are members of Europris. Moldova, unfortunately, they are not. But we are a member of ICPA, which is International Correction Association of Prison and Probation. And we can do that from our part in ICPA. We can spread that. It's a worldwide network of prisons and probation. So we can use this tool to disseminate all the activities and to use it. But regards the Europris, I think Italy, it's member too. So rather Italy or Cyprus, you can check that. So it's going to be easier from their side because they have a lot of events. So this is another opportunity to share, to disseminate our progress and what we are doing here.
As regards Europe, if they are going to promote it alone, I have to discuss it first with the executive director. Otherwise, one of the topics that of the COVID learnings working group is the vaccinations in prisons. So we can work it out how we can promote it through this topic. So it's another way that we can promote it, and then I can discuss it also with the executive director of Europris. Okay, thanks.
Any other suggestion?
Yes, exactly.
No, because I would like to tell something, because after the talk by Silvia, we have understood how important is also to organize transactional activities, and the point of migrants is very important. We have just constituted a working group inside the Italian Migrant Medicine Society that is specific for migrants in detention. And we hope that in this way, this cross-sectional work could produce some advocacy or scientific work, and we hope also something more concrete. Let's see, it's something very, very recent, and we will present this group at the Congress of the SIM, the Italian Migrant Medicine Society. This is just to give an example of how to connect different areas that are not different at all, because we are talking about the same people always.
Comments, please, colleagues. So, Babak.
Thank you so much. Well, yes, this is also about publicizing about among the scientific community, not the general population. But I think the process that we have started from the beginning of the project to publish short papers in high-impact journals, this is something that we need to continue. So far, we have published 2 papers in help me please, in BMJ, and 1 in the Lancet Public Health. And I think we need to, I mean, if any opportunity comes up, we need to take it, and we need to react immediately. Thank you.
No surprises, Babak.
Your point?
Just came to my mind now. I will, if you agree, I'll address in the Council of Europe. Sorry, I'll try to address in the Council of Europe the Criminal Law Cooperation Unit, because this also could be a basis to disseminate at least the knowledge about the project in several countries. And Council of Europe, with these 47 countries that could be addressed and that stick their heads together in their conferences. So if you agree, I'll give a message to the director. Thank you.
Great. Last comments, please. Any ideas, insights, share? Okay, I don't see any hands, and I would like to thank you very much for this very important and interactive session. Thanks to the presenters, to Fadi, and to all of you. I would call the session to a close, and back to you, Laura. Thank you very much.
Thank you.
So we come to an end. This was the last session of this very intense 2 days. I think we made a few steps ahead. First one is that we are a group now. We spend some time together. We try to solve problems. We had very useful discussions, I would say. We had a very nice dinner and time to, be social outside of what is the constraint of working setting and working meeting. So I'm very confident that we will go ahead with this project and we will be very successful. It's challenging. We've seen in San Vittore, just one example, but all of you are very familiar with the situation in their own countries. And we are, I think, very united by common values in this project. And this is what made me stick to prison health years ago. And I'm very glad that I did it every time that I have the chance to meet and work together with brilliant people like you are, all of you. So thank you very much for being here and being part of this project and this effort. thank you also to Paola and Linda, who are not here, but I know they are here with their heart with us. Thank you. Then I would also like to thank very much, like a big very much, all the people in San Vittore that has made this possible. I mean, Roberto, in the first place. Nicola, Marianna, Ruggero, Teresa, Georgia, everyone that was supporting us with the IT, and and all the people that have been, I mean, supporting and guiding us through these 2 days in this setting. So thank you very much.
Bye-bye.
Bye-bye, everyone. Thank you very much.
Thank you, and bye, Paola. I warmly thank all of you, Lara, and our team for being present or connected remotely, and for high level of your scientific contributions. I think into the penitentiary administration that it gave her hospitality, and the special thing into the male and female inmates who offered lunches and dinner. I think you agree. We have a lunch now, and the same recommendation of yesterday. We have to leave in this room your mobiles or any electronic device, and then collect them when we come back from dinner. I greet you very, very warm thank again, and have a nice travel home.